What day is today?
June 3rd.
June 3rd, Finance Committee meeting to order. I need an agenda. Sorry, I'm unprepared. First order of business is approval of minutes for the marathon from April. Jamie, could we take those in a group, or do you need a vote on each?
You can make a motion to approve the minutes for date. You can do them all in one vote.
Nice. Has everybody had?
Yeah, I did have a question on one of them.
Okay.
Carrie, do you have it?
Yes, so Ryan, the chart that you put together on the last night of the meetings on April 9th, there was a section about free cash that Tom is not in agreement with, or we didn't capture it correctly, correct, Tom?
Yeah.
Memory test, please hold.
Yep.
Is it in the minutes?
No, it's not in this package, Ryan.
It's not in
Oh, it
this
was sent
packet,
out.
I did not print out all the minutes, it's on the, in the link
Yeah,
that we sent.
I'm having internet issues, but I will take a look.
yeah, it's like page 61.
Okay.
61. Holy crap.
Do you know which date that was?
It was the last meeting.
Okay, so
Those are
I'll
right.
make a motion to approve the minutes as presented for the 6th, the 7th, and the 8th altogether.
Seconded.
Roll call vote.
One potential thing here for the minutes from Monday, April 6th, on the approval of the previous minutes, there's a comment in there about the minutes reflect that I said I was wondering if I could abstain because I wasn't at the previous meeting. I don't think that is attributed. I wasn't the one who said that. I think I got misattributed on this because it also says I abstained on the vote for approving those minutes. I think that might have been Tom.
Yeah, it
because, yeah, he wouldn't have been on the committee. Or that would have been his first meeting. So I just want to clarify that.
I will make a note.
We'll let AI know, John.
All right, so I do a roll call on Natalie's
Yep.
approval of minutes for 6th, 7th, and 8th, except for the correction that's gonna be made on, okay, roll call. All right, so I'll just go through everyone's names.
Yes.
All right, George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lawrence, yes, John,
Yes.
Brian,
Yes.
Shannon's not here yet, Jennifer,
Yes.
Tom,
Yes.
okay.
What do you want to do with the adjusted one?
Hold, please. Ryan?
Yeah, because I got nothing here. Okay. Okay, so what was the question?
You asked the question, who's in favor of using free cash? And I think I think there was like, majority of us said yes. But the way you kind of wrote it, a lot of people kind of said, I really don't want to, but I will. And the way it came across to me, Ryan, is that people said no.
So the table on the top was per person.
Like my comments, you have me saying no.
Okay, we can amend that.
But I think it was a general consensus of most of the people that they said, in a sense, that they wish they didn't have to, but we will do it.
Yeah, that may be just a semantic. I wrote not in favor of free cash, meaning like, it's not our preference. But it's not that like, we're voting no to it, it's just it's not like our favorite path.
Yeah, but it came across to me as no.
Go make a ball.
I didn't take it that way.
Okay, we can reword it.
Yeah, can reword it.
Yeah.
Yeah.
Yep, I can do that.
So,
Do we need to wait for it to be reworded before voting on it?
Yes, but it will be in September.
Okay.
And-
can we do it as amended?
Mhm.
Yep.
Yes,
Yeah, so that we get the,
yes,
get them out.
George.
Yeah,
on the
you
Yes, Mr.
internet
Chairman.
and whatever.
Yeah, so motion to approve the April 9th minutes, except with an amendment to note that Tom was not in agreement with using free cash, was that it?
No, I wasn't in agreement, I was in agreement to use it.
So maybe just.
I was, but the way I read it, it said no.
Got it, okay, so with an amendment to say that Tom
But I
was in
think you should-
agreement, yeah.
Yeah, but I think if I read a lot of them, it kind of had that same general tone.
So I
Just
think
with
the way
clarifying
to amend
language.
it would just be to say,
Clarifying
in the
language.
goals table, replace not in favor of free cash for all parties with prefer to avoid free cash.
That's better.
Perfect, okay. So, do you want to make that motion? It'll be
Sure.
clear.
So it's a motion to approve the minutes from April 9th as amended with replacement in the goals table on page 61, where listed as not in favor of free cash to be replaced with prefer avoidance of free cash.
Second.
Oh,
Okay.
roll call,
Roll call. All right, George,
yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes. John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer,
Yes.
Tom.
Yes.
Okay. Now I guess we turn it over to Mr. Allen for committee revised 1927. FY 27 town administrator operating budget.
Well, thank you, Mr. Chairman. I guess I just, I'm not gonna, I guess I'd rather just answer questions that people have than, if you want me to walk through the changes, if you want, whatever y'all want. But before I go into it for 20 minutes or something, I think it's just better if you tell me what you want.
How about highlights? Big
Okay.
changes,
Okay.
right, that kind of thing?
Sure. So, so really quickly on the revenue sheet. All right, as a quick background, if folks are watching at home, as always, go to franklinma.gov, go to town budget, and you'll see a link for FY27 budget materials. Anybody watching this later on YouTube can go to that link and see all of the details from the beginning of the budget year last August to currently. We've loaded up there online a 3-page staff memo, a revised control sheet and voting document. We did 2 versions, one with a notes version to show where the changes were that were in the budget, and then a clean version just with no notes. We've put in the proposed resolutions that are required in here. A few of them are just legal requirements. But Evan, our budget director and deputy CFO, did do a revised Appendix A budget document. So what we've done is we've updated like salaries, for example. So if there were vacancies in February, then we put in the actual name and the individual with like the hourly rate and the actual salary. What we've also done is, and so those are like more of the formal issues. But in terms of a high-level summary, on the revenue control sheet, revenues stayed fairly the same except for 2 categories. One, we did propose increasing new growth by about $65,000 to essentially pay for the benefits and the salary for the administrative assistant in the assessor's office. As our assessor said, the position will easily pay for itself. So if we can get that position on board by October, our estimation is then January through next June of calendar year 27, our 4 appraisers downstairs will actually be able to have full-time jobs appraising as opposed to doing administrative work. So we made that small tweak. Obviously the debt exclusion number, the debt went down a little bit for the Tri-County School because their interest rate was lower, but that has nothing to do with the overall operating budget. That's just part of the debt exclusion. The second piece is we did use the state Senate budget numbers. If you look on our budget website, there actually is a governor, House of Representatives, and a Senate version comparison of the local aid. But we did use the Senate budget numbers, which gave us an aggregate of about $630,000 in more revenue. So thank you to Senator Roush and Representative Roy, and thank you to the town council and the school committee. Both wrote letters advocating for local aid. The Mass Municipal Association, I think everybody's been trying to do the best they can, and those are good numbers. And even though our numbers are flatlining in local aid, to get that much more local aid is actually a really big win for Franklin. We did propose reducing the adjusted free cash usage to balance the budget by about half. So instead of 2.06 million or so, we're proposing 1.1. So in essence, your structural budget deficit as a community has been cut roughly in half. And we'll talk about healthcare a little bit later, which was one of the drivers. Also, local aid was a big driver. And then you can see in here basically notations that say updated state aid, Senate budget, which reflects all of the accounts that were affected by that. So state revenue as well as assessments and whatnot. So that's really the high level on the revenue issue. I guess I would stop there and just pause like I usually do to see if there are any questions on the revenue before I go through the high level assumptions on the expenditures.
Anybody? I have one question. You used the Senate budget?
Yeah.
What's the history on which one gets approved?
Well, traditionally they'll come back. The last 2 years they've compromised and they've come back to, I don't want to say the middle because it wasn't like they split it in the middle. But the last 2 years we did see a sliver of less local aid than we had in the assumptions. I would say that I did talk to both Senator Roush and Representative Roy at the Memorial Day breakfast, and they both believed that the higher numbers would prevail. Beyond that, it's an election year. I mean, at the end of the day, there's been a lot of advocacy around this stuff. The Senate budget made a $53 million statewide commitment to unrestricted general government aid, so that was a huge win. And that account affects every single one of the 200 legislators. If for some reason something doesn't work out like that, as you know, Mr. Chairman, we come back in November, and we're going to do a budget recap in November because that's what we have to legally do anyways. So when you come back in November, if they take a haircut to it and they cut us another 20 grand or 30 grand or something like that, we'll obviously make some adjustments in the budget to make up for that. But what I wouldn't expect is a huge cut to those numbers. The governor, the House, and the Senate all made huge commitments to Chapter 70, UGA, and all those places, and I think going into this fiscal year, given the fact that so many cities and towns were advocating for this, I don't think they're going to scrape that back too heavily.
Any more questions? I have one. Would this be the appropriate time to just go through the physical staff changes? I think, if my memory, we're restoring 2 SROs. We're restoring, I guess I use that word advisedly, the deputy town administrator. We're adding an admin and assessing.
And a munis administrator for the town and school finance departments. Yeah.
But that's all the.
That's correct.
And other than the munis and the admin downstairs, or the assessor's office, are the only new people.
Aren't there 2 part-timers in the assessor's office or the inspector's office?
That's right. The FinCom did recommend one part-timer in the inspector's office. So the part-time inspections official is new. The administrative assistant in the assessor's office is new, but as we heard from Kevin, he had a lot more staff years ago, so it's not like that's a brand new thing. The munis administrator, this is our second opportunity to try to retain somebody. We had in the budget 4 years ago, but we couldn't get a candidate, so we'll try again and see if that works out. But the other 3 are restored from cuts last year. That's correct.
Okay.
And some
Oh, One other,
Brutus is right, and we did restore the summer help for the kids in the DPW. Great point, thanks, Brutus.
but nothing earth-shattering at all, in my opinion.
Yep.
One other question about the quotes added staff. You're proposing they all start October 1st, or the budget shows October 1st.
Yep.
Does anybody have a guess? Because when I look through how we get free cash, which is a hot button, a lot of it is, the money comes from a position approved in July 1st and doesn't arrive until whenever.
Right.
Will that delay in and itself cause I guess the money's not in the budget, so it won't matter. I was
It's not in the
thinking
budget, that's why I
if we
did it.
didn't hire them, there wouldn't become free cash.
That's why we did that, that's why we made that move. Because they're not gonna get hired on July 1st. We'll be lucky if any of them are hired on August or September 1st. It's just logistics and time. So if you do it October 1st, then it gives everybody 3 or 4 months to post the positions, do the interviews, set them up, do query checks, background checks, go through the HR process. For the police officers, they gotta go through the psych exam and all that stuff. And then you put an offer letter out, and then they give a 3-week notice to their employer. So you're looking at October 1st realistically anyway.
Yeah, in the past years, we would have budgeted, they would have been available money starting July 1.
Correct.
And we're not doing. So it's
Correct.
gonna have some, quotes, detrimental effect on the free cash calculation later on. I'm just saying.
I don't think so.
No, it's prorated already.
Well, it has
You already
to.
prorated it.
We had appropriated money,
Yes, there will be less.
traditionally,
Yeah.
we'd appropriate money and not use it.
So
That by
you're right.
definition becomes free cash.
You're right. It's
Here,
not
we're not appropriating it, so it can't become free cash.
Yes.
It's not detrimental to free cash, it's just not
Zero
baked
effect.
in, like you will not have it
Yeah, all right.
pre-held that then turns into free cash, so just like are avoiding the whole process. So in whatever it is, December or January, we may have less free cash than we've had in previous years.
Yes.
It doesn't detract from the free cash, it
Right.
just isn't, we're not putting it
No, we're
aside
not
to not
using
use.
free
It was
cash.
never available
Well, that's what I
to
was
begin
just
with.
gonna say, Linda Dowling, the
Using it.
comptroller.
We're just,
So if we put it in as of July 1, you'd be using technically free cash now, and you'd get it back later, if we didn't hire them.
but I just want to
But
make
it's
sure
not a
we-
detriment, it's not really.
The real detriment is if you use it's $147,000 by making savings of free cash that we don't have to use in this budget, which allows you to spend $148,000 on the healthcare deficit in tier 2
Right.
capital. So that's really the ultimate impact of that.
Okay, just wanted to make sure.
But there's a year-over-year challenge there, right? So next year, if nothing changed at all, the budget would go up 150,000.
Correct.
Whereas if you budget it now as if it's the whole year, even though that's a free cash into the bucket, then right back to free cash, at least then your budget this year, like, again, if nothing changes, next year, the number stays the same, instead of right now, we're saying it definitely goes up 150K.
Correct. Unless, again, I think, and I know you know this, that's one issue among, 50 departments, 150 million, so all those things are gonna change one way or the other.
Yeah.
You're correct. But you are already assuming that another 150,000, plus probably a COLA, is going to be
Right.
baked into that number for next year. You're exactly correct. So the
So
fiscal forecast we put on in August will show full year salaries, and it'll go up at least 150,000 plus 2% or whatever.
Right.
Yep.
So when we look at it next year, any department that added someone this year is going to show a bigger increase in the next year budget cycle because they have a quarter of time that they're effectively increasing de facto.
I fully agree, I just want to make sure we put everything on the table.
Yeah, but George,
Yes.
there's a normal turnover of employees. What's the turnover percentage?
Pretty low.
I need a munis administrator to find out.
Touche.
I said I need a munis administrator to give you that data.
Okay, but there is a normal turnover, and you save that salary, which turns into free cash.
Right, I mean, I think what Tom's getting at is the usual, like, DPW is the best example. I mean, our turnover rate is very low. And I'm serious, but I think when you have positions like labor, you know, in DPW, those are the ones that turn over, and then you've got retirements for more career employees at teaching, police, fire, those are the turnovers you see. And so when you have those gaps, that's correct, that's where you end up getting some of your excess free cash.
Just point of clarity, teachers turning over would not flow into free cash, right?
Correct.
That would stay in the schools. Yeah, into their sub-budget, which is similar but different.
Right.
I don't know.
And I mean, same comment to the added positions, like we just listed all the added positions on the town side. There were a few in the school side as well. There was some movement positions. I never got super clear on it, but.
That goes into, I don't know, frankly, I don't know what they do. Is it revolving?
I think generally they're gonna end up spending the money by the end of the year. They're either gonna prepay a bill for next year, they're gonna end up doing a capital improvement somewhere, they're gonna buy a van, you know, they're gonna, and we do the same thing, right? Like, I mean, if we can take capital items off the list and we have money to do it, let's do it. If, you know, they can move and pay a bill for next fiscal, like, we're all in support of that, but I think to Ryan's point, it's not exceptionally dialed in and very clear. But
Jen House.
maybe Steve's got some.
I'm sorry, it's not clear, but I do have it recorded at least twice that if the opportunity were to occur, the money would flow to free cash. You're correct. Generally, the schools don't let that happen.
Right.
But if there was a condition, it would go to free cash. So it's clear the habit is not there because of the way they manage it.
Right.
But it is clear, it operates the same way. It is not terribly different between town and schools. And we're going to do another finance discussion to help clarify that, but I've already got them on record for 2 times, and you can listen to recordings and I'll share you the links. It's already there. Thank you.
Sorry, the point of wasn't clear, it was more around the staff being added than how the cash flow works. There was a lengthy list of pluses and minuses, and then there was some grants being used to pay for some staff, and then.
There were 7 positions that, having landed the bus in their terminology with the reorg, they had additional positions that because of the failed override, they took away. So they reevaluated those positions that they took away, and some of them they really needed.
Sure.
So they made other decisions. So the 7 pluses and the 7 minuses stayed within the net. So there really was no net change. But yes, there were 7 different positions than what was initially done because of their reevaluation.
And they're not doing something similar, right? Like where they're assuming they won't be able to hire those until October and.
I don't think so, because I think their schedule is obviously so much different because of the school year starting, and so they hit this point with state law where October 1st, they have to do an enrollment. Like, there's a lot of different other pieces where they have to declare certain things to the state. So as Lucas and many superintendents have said always before, you know, that's why the June vote is critical, because giving them money back in November doesn't really help them out because they can't really hire anybody that year because the school year's already started.
Sure.
So I think they make all of their staffing decisions pretty early in the year, you know, if not by July.
Oh, I'm good. I'm good. Thank you, Beth.
I have a revenue question, just curious. Do you have any additional revenues baked in for the World Cup?
No. I just, so the only real revenues we get is from meals or hotel taxes.
Right.
Which are all, you know, unfortunately statewide, as there's been many reports on this, hotels are not booked in Boston, all over the place. Because we're a state that just can't have fun and get excited about something like this coming. We're just really boring. And international travel is down, you know, so I think there's a bevy of those. But Restaurant Week is currently going on, so maybe we can all go out after the meeting tonight. But in all seriousness, the fees bylaw the council approved is baked into these assumptions. So the ALS, BLS rates, the Beaver Street recycling, your recommendation, like a bunch of other stuff they already passed on reading 1 are in there. So we hope that those increased revenues will also help with local receipts, but nothing specifically like World Cup here, you know.
Just maybe following up on that, do we have any additional costs? I would assume police for,
We did get grants to cover all the public safety costs and all that stuff through the state, yeah.
About the common TV screens and all that stuff, is that some coming from town or from?
It's all
somewhere?
state revenue. Yeah, it's all, unfortunately, the grant money for the World Cup was held up in the Homeland Security debate at the federal level. I mean, this was nationwide, right? So every state was waiting for that to trickle, and that's what got Foxborough into saying, we're not going to approve these. And so once the money finally got approved at Congress, then the money went out to the states, and I think the governor and everybody have been doing the best they can to get these things out. We did get 2 awards for it, so to pay for the public safety and also the supplies up there. The key for revenues from a World Cup is encouraging people after the watch parties to go out and eat and have fun with their families. It's the last 2 days of school. You know, just celebrate and try to go out and have a safe, fun time. And, you know, I think it'll bring our meals and other revenues up probably hopefully by the end of the fiscal year.
Mr. Chair, if may, complaint from one of the residents that the microphone use is not appropriate by some of the members. They need to be careful using the microphones, especially since at least a member of the school committee was trying to understand the discussion, and they couldn't. So, thank you.
Mayor Cole. The only other thing that I'd like maybe to touch on is what happened with healthcare and GIC and that. I think it says in here, it went up 21,600 and something,
Yeah.
which to me, it sounds pretty good, but is that true? No, that's a bad way to put it.
Thanks.
Horrible way to put it, but
All right,
you know
so
what I
let's
mean.
just
Is that
let's
a
just
good number?
Time out for a minute. Let's just go do a little overview before we get into this. So, so just so everybody knows, I want everybody to be clear, I said it before, but I implemented in my final revision every recommendation the Finance Committee made. So it's reflective in the notes. I'm sure you all saw it, but for people that are watching at home that, you know, are on YouTube and stuff, in the notes column, you'll see in there Finance Committee recommendation, reduce budget by 1,000. You'll see all of those recommendations for the increases as well as the decreases in the notes. You will also see in there the references to what the chairman just said, where this position is being effective October 4th. Then there's a few of the expenditures that went up. The Tri-County budget went up $341,000. That's an enormous jump that was not expected at all. And the reason is they added 6 students, but they also, their per pupil cost went up $1,202 per pupil. So there's 186 students that go from Franklin to Tri-County, so that represents that $341,000. The MEC assessment and animal control, as I mentioned earlier in this year, went up a combined between the 2 of them about $100,000. So that was kind of expected. So that's not way out of whack, but I just wanted to reference those. You already referenced the position starting on October 4th. So to the benefits budget, the entire benefits budget was lowered $460,000. Okay, so when you get into the notes view, you will see a $158,000 deduction because there's a prepay option with the pension system. So if we pay on July 1st, you get a point off. You'll also see in there some other tweaks to workers' compensation. You'll see some other tweaks in there relative to unemployment insurance. These are all positive trends. And in liability insurance, just below it, we saw about a $69,000 reduction on our actual quote from what our estimate is. So when you add all these things up, and we'll get into the actual healthcare, I just want to point out that there were a lot of positive trends here in workers' comp, unemployment. The last couple of years, we anticipated high unemployment because there were layoffs, right? So we're not anticipating any because of free cash, we're not anticipating any layoffs, which helps our unemployment numbers, right? So when you look at all these and we got the actual quotes, these are based on actual real numbers of assessments brought forth by those institutions. It's important to note for the people who are new to the budget process, this is very normal. Every city and town goes through this, where you do estimated at the beginning of the year, and then the pension board votes and other entities vote, the Maya board on property and casualty, and then they send you letters saying, here's your official assessment, or here's your official quote. And those don't usually come in till March or April, depending on what the account is. So I just want to make sure everybody knows that this is very typical, and you know, if you're going to follow the budget process along, these are the realities that are there. To your point, George, about healthcare, and obviously Karen hopped up to the mic. Overall, what we saw with active employees was a very good trend, and the moving to the GIC actually saved on active employees only. Okay, the GIC saved almost $750,000 in premium payments. That is also going to see a benefit on the employee side. But what we're seeing is obviously younger employees. We're seeing a little bit more individuals, but people with more choice, with plan choice, get to pick a plan that's more applicable to them. So I think we see that in some of the data, and overall, to save 700 and I think it's 763,000 technically, but 763,000 from our estimate earlier is really, really good news. The bad news is that entire savings is offset because of the retiree costs. And as I said at another, I think on Steve's podcast, nobody's blaming the retirees for this problem. I know I'm gonna get a call in the next 3 days from a retiree that's mad. It might even be my predecessor. But we're not blaming retirees. But the impacts of the big beautiful bill last year in Congress are now starting to reap the downriver symptoms of the problem. And unfortunately, the subsidies to the Affordable Care Act, Medicare, and Medicaid are having a downstream consequence, and as a result, the retiree enrollment spiked up almost the exact same amount, so ultimately it was about a wash. Now, Karen will probably talk a little bit more about some of the trends within those numbers that show us a lot of optimism going into FY28. I would also note in the healthcare budget, there's a one-time premium holiday that we were required by state law to give the employees, because when you save money by moving to the GIC, you have to give them some of those savings. And what most cities and towns do is we give the savings to people in a premium holiday for 1 month. So 430,000 of the healthcare active budget is going to come off the books in FY28. So that's a really positive thing. So while the numbers still look a little tough, you're going to take 430,000 off that budget in FY28. When we do the fiscal forecast later this summer after the budget's approved, we will make that note and we will take that money off structurally in the budget. So that's, I think, the broadest of overviews you could get. I'm sure other folks have some questions on some more of the specifics in terms of enrollment or what the rates were. But ultimately, by staying the course and staying in Mass Strategic, we would have seen certainly much, much higher costs on healthcare, and we would not be seeing the trends going over the next couple of years anywhere near as good as it is now. So as I look at it, as Karen and I have looked at healthcare together now for 10 years, moving into the future, provided that there's no income tax repeal, provided that cannabis doesn't get repealed, provided that there's not an economic downturn, a world war, or more cuts from Congress, moving into FY28, our healthcare budget should start to move in a much, much solvent direction. So I think it's pretty good news.
I'd be surprised, because don't forget, the insurance companies just went into the hearings at 17-18% for the upcoming year.
Well, you and I, we're not going to hog the conversation, but I mean, in the global sense, this country just cannot figure out healthcare. You have the Affordable Care Act approved in 2008 by one vote through a budget reconciliation maneuver. You have the big beautiful bill going through a budget reconciliation. You have half the country that wants more subsidized healthcare, and you have half the country that doesn't want subsidized healthcare. I got jokers to the right of me, clowns to the left, and here I am stuck in the middle with you. Ultimately, we're here at the bottom of the river, at the mouth of the river, and we just have to deal with what is like kind of what we're given to us. And we're trying to plug an issue that's really hard to plug within a framework that doesn't necessarily always work. And that's just the inconvenient truth. And I think what we try to do is manage it the best we can. but also we have exorbitantly high claims. So when healthcare companies in Massachusetts are losing 5 cents on the dollar to us as a town, you can't reasonably expect to have all these good competitive marketplace come in and give you a great percentage and a great bill when they're losing money on us year after year. So I think a lot of cities and towns find themselves in the same situation. The state government, by the way, is going to have to deal with this next year after the election in FY28 themselves. I would highly expect the healthcare working group task force at the state level to go through a series of healthcare reforms at the state level. But we also know our state government is backing us up with surety being in the GIC. So not only are we protecting our financial solvency in the future, and I mean this really sincerely, we're also protecting our employees' families, and protecting our organization from a recruitment standpoint that, you know, if we can't somehow pay for good health care for employees, we're not going to be able to keep good people. And we may end up being forced down the line with unsolvent health care to lay off people because we've got to prioritize health care. So there's a lot to all this. And I still think overall the good news is our actives are moving in the right direction. Our healthcare deficits will be paid off. Next year we won't have to use free cash for healthcare deficits, hopefully. Obviously not with the situation we're in, but to Tom's point, as a former health hospital CEO, I'm sure he's pretty knowledgeable of this stuff. I don't know what to tell you. So Karen, I don't know if you have any other data on subscribers or if you guys have any questions for her on rates or stuff like that, but happy to answer anything you want.
I have two questions. Sorry, go ahead.
Technical question, Carrie. How do you account for the employees' deductions? Is that a revenue or is that offset the expense?
Offset the expense, just to confirm.
Yes, it basically just is an in and out.
It's an in and out.
I have two questions. How many, I see 470 retirees, how many are on how many are covered that aren't employees? Just curious for the town.
The retiree numbers are always,
Well, that one says 470 here. I was curious, like, other than retirees, how many people are on the town, how many people are included in this that we provide healthcare insurance for, just in general?
for active employees, they're,
534.
yeah, we have 534 enrolled out of 1,030, so about 52% of our active employees take the
Take
insurance.
the insurance, okay.
Yep.
And then my second question is more, probably not, it's just in general. You mentioned something that sounds really scary, that if the costs keep going up and we're faced with having to pay for increased premiums, and that might come at the cost of employees, and then we have to make that unfortunate decision at some point. What's the process for the 70-30 split? What if we wanted to go 65-35? You know, what's the process for that, just for everyone in the committee to make that? I know that's not a good decision because that means a pay cut to everybody paying benefits, but if it would come to that in order to preserve jobs, I was just curious what the decision-making process is there.
So we worked through the Insurance Advisory Committee on that, which is made up of employee representatives of all of the major employee units, also included non-union. I will note, so that's the process.
Okay.
When we were in 2009 to 2012 during the recession, the town went down to a 68-32 split. So similar kind of circumstance you're talking about. The 68-32 split was the lowest, that is the lowest percentage of any area municipality around here. Most towns offer a 70-30, but even just as many offer a 75-25 split. So we are in a very non-competitive situation, particularly when it comes to teachers. And I say them in particular because they have a much more voice and active role in healthcare. It's also a 3-to-1 ratio roughly, where there's just more people. And so the 70-30 split has been an issue in the past, or the 68-32. And oftentimes because you have a lot of communities around us that also have 75-25. So, but if it did come to that, we'd go through the IAC, we'd make a group decision. Do your labor unions, do your staff want to maintain jobs, or do you want to offset premiums? So we would go through the IAC on that.
Okay, thank you.
Have we ever audited our employees to make sure that the kids are their kids, the wife's their wife type thing. Have
Oh,
we
yeah.
ever done that?
We did a full enrollment last year when we were still insured with Massachusetts Strategic Health Group, and everyone was required to provide birth certificates and marriage certificates. And when we're joining the GIC, they had to do that again, and they were pretty strict on that.
Yeah.
We didn't, I don't know if people may have not enrolled knowing that, but we didn't catch anyone that did not, was not covered.
And that's part of the employment now that everyone has to show.
Yeah, they have to do it
part of
upon
enrollment.
hire, but we hadn't always done that. So when we took over benefits on the town side, we did that through our first enrollment, and now it's required every time.
Max?
Hello, Max Marangello, 127 Central Park Terrace. I'm sorry to invade your meeting. I actually had a question. I thought I might as well ask it while I'm here instead of, because it might take some time to get the information for the council meeting. In January, you had a FY '25 expenditures analysis by department report, and it showed how much money each department has actually expended. I just was wondering if that's something the council could get ahead of their meeting, as well as if there's any departments currently that have not, still have like 10% or more of their department budget remaining, just so we make sure that, you're asking for money, you're actually spending it all, that kind of thing. So that's, do you know off the top of your head?
It's called a year-to-date. We do
Yeah.
usually do year-to-dates and absolutely easy to provide. I think that's what you're asking.
Yeah, for expenditures. Is there any department that is below their benchmarks?
So, yeah, so what happens is historically what we do is at your June 17th council meeting, you do what's called year-end transfers. And those year-end transfers are designed to get approval. So if legal expenses went over a budget by $5,000, you have to then find the other $5,000 in another department. We usually do about 100 to 100, I would say between 50 to 150,000 in year-end transfers every year, roughly. So out of a $150 million budget, you're doing between 50 grand and 150 grand worth of transfers. It's usually very light, and the reason why is almost every department spends within their budget. Sometimes you might have an election cost that went a little over, or some overtime in a fire department because of an injured on duty, or procurement came in a little bit more in a small budget, right, like planning or something. And so usually what we do at the end of the year on your June 17th meeting, you would do those updates then.
Okay. Thank you very much.
So, and just to add, for any of the department heads here, if you come in under your budget, you're gonna get a thank you, not anything else. I don't feel like it's a spend it or lose it, like, it can go to free cash and you'll still have your same amount next year on your budget. Like, we don't have to, because there's a stigma around government
That memo
spending being
just
that way,
came out.
we don't have to follow it here in town.
Yes, to your point, Ryan, we just sent out a memo to all department heads stating that.
Perfect.
Verbatim what you just said.
There will be no,
I thought maybe she sent it to you guys.
That's good. But, by the way, Max, I think on our agendas, the first agenda after March 31st, there's one of those reports in that
Yeah.
agenda.
You can look at the last FinCom, the quarter 3 is in one of the previous.
Yeah, isn't it? If I remember correctly. So, it's produced by probably the new Munis administrator, a better one.
That's right.
What do you
AI.
got?
we got big hopes for this municipal administrator.
Yes.
Can I ask one more question?
You can
about-
ask all you want.
So the fact that we got more favorable rates switching over here, is there, only because I went through this with our company where we moved healthcare, we got a really good one-time rate until they got access to all of our claim data. And then the very next year, we had a whopping giant
Yep.
increase. Is there risk here for that as well?
I think we minimized a lot of that. We have had that in the past.
Okay.
When we've switched insurance, they give us a very good rate year one.
Yeah,
We're now with the entire state, so we happen to be new to the Group Insurance Commission, but it covers about 500,000 people.
okay.
It's every state employee, and then towns or, smaller districts can opt in. So I think that's one of the perks, is being part of such a big group. And they're also self-insured. So it's basically, the premiums go in and they pay from it, so it's not subject to the same kind of volatility, I don't think.
Okay, okay,
So we should be able to prevent that by being part of the larger group.
okay, that's helpful, thank you.
And their rate increases have typically been a little bit lower than what the town has seen in the past.
Yeah.
It was like, I think it was 7 to 12% range of FY '27 over their FY '26 rates.
How,
When you have 500,000 people on a healthcare system like that, you have a larger stakeholder and political base to make sure that they are strong to maintain competitive healthcare, particularly for public employees, because this is theoretically one of those reasons why people get into public service, is there's supposed to be good benefits. So when you share that risk pool, to Karen's point, you're gonna get a little bit better rate structure because you're sharing your risk, and obviously we're a risky organization. Because our loss runs, and we have more claims than money coming in. So when you have that kind of pool, you gain a little bit extra political power, if you will, with the administration and the legislature, because all lawmakers have a lot of people in their districts that are dependent on this. So that was part of the strategy when we did this, is that we thought this was a more solvent system for the next, for the rest of the decade at least.
But if I remember correctly, when I asked the question, they did not ask for the loss runs.
They did not, nope. They don't actually look at loss runs. They'll let any group that would like to go in, go in.
But that's a state issue.
I know.
Jen?
sorry. Do you know what the rate was if we had stayed in the consortium?
They were estimating around 12.
Okay, I just was curious.
Yeah.
Okay.
They didn't really keep going beyond December with like analyzing our data since
Yeah.
they knew we weren't gonna be there.
Yeah.
Right.
But I did do a little bit of analysis sort of FY '26 to FY '27, and the most popular plan in the past was our high deductible plan. And our most popular plan, this is for an individual, would be the WellPoint Plus plan. So for those people going from the high deductible individual to a WellPoint plan, it was only a 3.5% increase. So some of that data, some of the cost-effective plans, people experience a very low increase.
Yep.
So that was 3.5. And then similar one on a family plan, there was actually there was a decrease on that one as well. Sorry, my numbers actually don't look correct. But even the most popular plan would have been about a 14% increase. So, we're right balanced out. And our Medicare, so every employee that was on an EPO plan, which was our HMO, every GIC plan was cheaper than that. And every Medicare plan was cheaper than what we currently have. And then the high deductible plan was a little bit more cost, but there were also lower cost options. For this year, our biggest goal was making sure everyone enrolled, and we got over there. Next year, I think we'll do a little bit more on education about some of the lower cost plans and some of the perks there, where people can save money and also save money for the town for very similar coverage.
Now, the Medicare plan is a supplement plan.
Supplement, correct, yeah.
Don't use that, it's a personal experience, just personal. Anybody else? I'm just curious. You said we're a high-risk town. Is Brutus putting something weird in the water or something?
No, it's like call volume for police and fire. This isn't, I say this with all due respect, healthcare consumption's gone through the roof. It's a consumer demand issue. We live in the highest cost healthcare state in the country. We have the highest premiums. It's a big part of our economy, right? It's what attracts the best doctors from around the world because of our schools and our institutions. It's just, I don't know how to, I can't get into like this, why can't we fix this system to make it more affordable for people? I don't know of a state in the country that's not complaining about this. You have half the country that wants to get rid of subsidies at the federal level, half that wants more. It's just, we can't seem to come to a consensus. And as a result, since the pandemic, our loss runs before the pandemic were reasonable. They ebbed and flowed, but they were like 95, 94, 96, 88, 102, 101. They were up and down, but they were manageable. We would make a few tweaks in the plan design with the IAC, maybe tweak a deductible, and we get, I think there were years we had like a 1%, a 0.6% increase, a 2.5% increase. Our increases pre-pandemic were very reasonable because we had a group of people working together, and we used to come into the budget presentations every year with a slide they called Bend the Trend. That was our theme for like Steve, I appreciate that Steve remembers it. And even when Jeff was here and I wasn't here and Karen wasn't here, they would talk about bending the trend because we'd work with the school employees and everybody to find the right middle ground on how to manage the issue. And, you know, I feel like we all say this all the time, but since 2020, you know, mental health, anxiety, cancer, high-cost claims, I mean, the expense of the system, inflation, you know, Mass General Hospital was impacted by inflation. Do you think we'll just eat the cost? Of course not. They jacked up rates. So everything has just gotten more expensive, and I think healthcare is a symptom of the entire inflation problem across the country. And as a result, our organization had a lot of high-cost claims over the last 4 or 5, 6 years from some, you know, some extremely, it is what I don't know how else to explain the trends in healthcare. Life expectancy has gone down 4 years on average over the last 6 years, 7 years. It used to be 82, now it's 77. People are dying younger. They're dying because they have illness, disease, and those are high-cost claims that get built into the system.
I think just to put that into perspective, I just pulled a report. We had our high-cost claimants, 27 people, cost $3.1 million. So that's just some of the sickest people in our population, employees, spouses, their children. A person with diabetes, $485,000. So those are the kind of numbers where.
Yeah, stop loss, I hope.
The stop loss hit for the first 175, so we're still on the hook for 528. But we're also paying part of our premiums going towards stop loss insurance.
And then in the GIC, do you have an aggregate, that if you exceed the aggregate, so there's no, okay, it's a premium-based plan, forget it.
Yeah, they're not coming back to us for
right.
the costs.
Now, as you looked at the cost of healthcare, did you break it up between medical and pharmaceutical?
We haven't, our group has. Yeah,
I bet you see a different trend.
there's a
between
much
medical
higher cost on
and the
pharmaceutical.
side.
We do get rebates through the pharmaceutical, you know, we get a rebates 3, 4, 6 months down the line. The administration of it all is very slow, because they don't want to give the rebates back, but, you know, eventually they get there, so.
All right. Anything else before we move on to the voting documents?
Resolutions.
Hmm?
We got a lot.
So just to be clear, the, you know, you've got up until capital round 2, item E. So item 3E. Those first 4 votes all have to do with the operating budget. The town clerk's salary, the stabilization transfer, and the revolving funds. So maybe you take those off just as one section, and then I'm sure there's some questions that people have on the capital round 2. If you don't, great, but I'm sure you do. Maybe just go one in order, George.
Go one by one.
So 3A, all of those items are just information, more than, there's no votes involved, correct?
Unless you want to make a recommendation to recommend the adjusted budget to the council next week.
I think that would be appropriate.
Yeah.
I guess just one quick question on my end on the enterprise funds. What is the $850,000 reduction on the principal and interest for water? I see it says like removing the principal and interest, but relative to kind of what was brought forth before, I guess what changed?
Yes, that's a great question, John, thank you. So when I was working with Doug Martin, the water and sewer superintendent, he has a project going on where we have the loan through Mass Clean Water Trust, and the project is not more than 50% due, so we do not have to begin paying back the loan, but I had budgeted like we should be paying back the loan. That's why the reduction.
Gotcha. Thank you.
You're welcome.
Okay, so,
So motion to recommend the adjusted budget as recommended to the town council.
So moved. All right.
is
sorry.
that I wasn't clear. Which, can we put a number on the end of it,
It
or
was
is that
just
appropriate?
It was
The
the
resolution.
adjusted revenue and expense sheets with, it included all of our finance recommendations as well as the adjustments that we just discussed.
Okay, is there a number?
But there's not really a number, because it's like the balanced budget of what is it, 152,
170, 284, 565. 170, 284, 565.
And Natalie, do you want to add the use of free cash?
It's in there.
it is in there, yeah,
It's in there.
reduced
No,
to.
I understand that, but be explicit about it.
Yes, which uses free cash of the $1,104,132. Nicely reduced.
Second?
Got a second?
I already seconded.
Oh, second,
Oh, all
okay.
No worries.
All right,
Um,
roll call?
Well, discussion
Oh,
on any of
discussion.
that? You set? Okay, roll call.
Okay.
I have a question that might be a stupid question, but I thought that that when we were talking during our huge 4-day budget blitz mania, there was $2 million in free cash to use. And then we had a lot of discussion about not using it, using some of it, whatever. So where did that $2 million go? That's for lack of a more articulate, I'm tired. From
Yeah.
by
And it's
more
only,
articulate.
where did the million go?
So,
So we had 2 million.
well, you had just for rough numbers, you
Yeah.
had 2.1 million in free cash in
Yep.
the original, using 1.1 in this.
Yep.
So you're saving, not having to use $1 million in free cash. So that remaining free cash total is recommended further down in capital round 2. So essentially, that million, if you want to make it easy, is basically paying the healthcare deficit off from the current self-insured program. And then capital round 2 is assuming the OPEB contribution is not moving forward, and so you're able to pay for the tier 2 capital costs that were in the tier 2 capital plan.
So we're jumping ahead to assuming that that money's gonna be used. So we had 2 million
Correct.
roughly.
Correct. Yep.
We are using $1 million to
Pay the healthcare deficit.
fill the budget,
Yep.
so then we balanced
Right.
our budget, correct?
Correct.
Just trying to use the reason I say all this is because there was a post, again, Facebook being what it is. There was a post on Facebook about how the finance committee recommended using all the free cash.
Yeah.
And that wasn't our recommendation, number
Totally.
one. I was
Yep.
here. 2, it's not using all the free cash.
Correct.
I think that there's a lot of misunderstanding and miscommunication. So if I don't understand it, then I'm guessing other people, maybe people that are smarter than me, also don't understand it. So I wanted to get the numbers clear so that we're not talking about this the way that we've kind of talked about it in the past, where it's just like blah, 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 and then it's gone. Like,
Yeah.
so there's $2 million. I just want to reiterate it, I know, probably for the fourth time.
2.1 that was
There's
used originally.
$2.1 million that we had in free cash.
No, that was just a piece that we were using. It's a
He
higher
spoke, he was
balance.
gonna use.
Oh my goodness. The 2.1 that was proposed in free cash in February is now 1.1.
Right.
Easy peasy for anyone to understand. So the 1.1 is plugging the structural budget gap to prevent any cuts or layoffs. Very, very easy to understand. But to your point, you're right. The public is confused because I don't know who talks to the public to assure them that they're wrong or incorrect. So we were not using all of the free cash for the budget. You're 100% right, but I don't know who's saying this on Facebook, but maybe
So
somebody could tell
here's where the
person on
confusion lies, because I just said a statement,
Yeah.
a very one sentence.
Yeah.
We had $2 million in, and I heard already, no, it was this, it's that. Up here, there's no-nos. So again, it's $2 million in free cash, right?
Keep going, yep.
Then we used $1 million, 1.1, 2.1, and then we used 1.1 to fill the budget.
Correct,
And now we have a balanced budget.
correct.
And now we have $1 million left, right?
Close, yep,
Roughly.
yep.
And that is what we're gonna use maybe for the capital expenditures.
to add to the existing free cash that was left over.
That's-
Originally, there was free cash, what was it, 4 million?
It was like 4.
Was it 4 million? 4 million free cash.
Good, let's do it
Originally
this way.
budget,
Yeah.
originally budget to fill, original budget, there was 4 million free cash. Original budget, 2 million to, yeah, 2 million to
Sir,
plug
excuse me,
the
a lot
gap.
of people aren't reading this.
That's
So
what, but they should. That's what I'm
But,
saying.
and because they aren't, we can't just say to them, we'll just
But they're
read
looking
it.
for you to basically clarify it.
Correct.
So clarify it for them.
That's what we're
Yeah,
doing right
so,
now.
yeah, so 4 million, I'm rounding, 4 million free cash originally left over from last year's. Current year budget, when we started the process, there was a structural deficit that we plugged with free cash, 2.1 of the 4 million. So there was always leftover free cash, we were never using the 100% free pot. Marathon sessions, lots of changes with benefits, 2.1, the gap then became 1.1. So 1 million is going back into the free cash pot. So if the 4 million was originally 2 was gonna stay and 2 was gonna go into the budget, now it's 4 million, 1 is gonna go into the budget, 3 million is gonna go towards capital.
Perfect. Thank you.
Yeah, round numbers.
Not towards capital.
And the reason for the decrease between 2 and 1 was a variety of,
That's not where the confusion is, the total versus what we were using.
yeah, but.
Thank you, Natalie. That's exactly what
Yeah.
needs to be said out loud.
The interim deputy town minister solved that, town administrator. Okay, any more? Set? Anybody out there? Zoom, anyone?
All right, roll call. George?
Yes.
Natalie?
Yes.
Chris?
Yes.
Lauren, yes. John?
Yes.
Brian?
Yes.
Shannon?
Yes.
Jennifer?
Yes.
Tom?
Yes. Okay. So we 3A is now done with a recommendation.
Correct, now 3B. Yep.
Okay, 3B, which is the MEC stabilization transfer. You want to read it? Well, let's, what does that leave in MEC stabilization?
What does that leave?
So.
400
Yeah, go
something?
ahead.
So we're spreading out the remaining of 400 and something thousand,
50,000.
saying 50,000 for the next 4 years. So we're using 117,333.
133.
Because we're just essentially bleeding out this account.
Yes, we are.
Correct. And this has been part of the original discussion built into the budget.
Correct.
So make a motion to, do we say adopt? Resolution 26-27, which is to appropriate 117,133 from the MEC stabilization account to the FY '27 operating budget.
So moved.
Question?
Yes.
What is that stabilization fund?
The stabilization fund was set up in 2020. The regional dispatch center merged
Okay,
with another regional dispatch center, and there was a state grant, but we needed to save money away for when we were gonna be a full assessment, so it phased in over time, so we didn't get hit with a big $900,000 increase one year. So this just smooths out the increase back to 100% assessment.
And just another point to that, this is a special purpose stabilization fund, not a general huge,
Right.
this was
Yeah.
specifically for that.
Specifically just for that.
special purpose,
Yeah.
restricted for its use.
Correct.
Okay. George?
Yes.
Natalie?
Yes.
Chris?
Yes.
Lauren, yes. John?
Yes.
Ryan?
Yes.
Shannon?
Yes.
Jennifer?
Yes.
Tom?
Yes.
Yes. Okay, so the next resolution, so make a motion to adopt resolution 26-28, which is to adjust the salary schedule of the full-time elected official town clerk, changing to FY '27 salary of $117,004.
So moved.
Question? Why is this a vote?
Because she's an elected
elected.
official, and by law,
And your township.
if you were in town meeting, every year, town meeting would have to vote on the
Right.
salary increase.
Okay,
Questions?
so it's a state law.
Yep.
Go ahead.
Okay, George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes. John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer?
Yes.
Tom?
Yes.
This one's a little longer.
Yeah, I'm just kind of reading it through. Okay, so, motion to, adopt resolution 26-29, which establishes new expenditure limits for FY 2027 of the departmental revolving funds. As noted within the, I'm not gonna read them all through, but, unless I need to, but, as noted within the specific resolution.
So moved.
Questions?
Yeah, each department has its own revolving account.
Not all of them,
I should
but
say that the ones that were identified.
correct.
State law requires on an annual basis they get reauthorized. It's probably not needed, but it's state law, so that's why we do it.
Okay.
Is the amount just basically what they spent last year kind of thing?
The
or-
amounts are the same as they were last year, and they generally go in and out. I mean, some of them get a little surplus here or there to be used, but they are dedicated. These are special revolving funds that can only be used for the declaration of what their purpose is. Like the EV charging stations we set up can only be used to take in money and then it goes out. So if the EV charging stations out here, if people use them, they pay them, they go into this account, and then we pay the electricity out of this account. Same thing with senior center fees. That's where that's where all the cafe fees go. So it just goes back into buying food. You know, it's just basically going in and out.
Anything else, guys? No?
Okay, George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes. John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer?
Yes.
Tom?
Yes.
Okay, capital round 2.
So we wanna talk about this before I make a motion?
Now you can make the motion and
Okay.
discussion.
Okay, so I make a motion to allocate $1,528,919 from free cash for round 2 capital expenditures as listed within the resolution.
So moved.
Discussion. Jen?
Just a couple of quick things. The 1 million deficit is an estimate till we get the final number in the fall.
Yeah, the deficit's currently at $1,022,000 at the end of April. But it doesn't necessarily mean that the deficit, it could be lower,
Yeah.
it could be higher. But we'll get to that, I think, on the other resolution that's coming up on the GIC trust fund, that's the next one.
Okay.
So what will happen is June 30th, we'll have a final number. Prescription rebates are gonna phase in over 6 months. I think it's gonna be a full 6-month transition, and we're only gonna pay the invoices that we need to. We're obviously gonna check all the accounting. We have found errors in the strategic health group before. So I'm not paying a single bill until we've gone through all the facts and the data. But I think what they're gonna expect us, which is for cash flow, and I understand this, in a group that's in deficit, by the way, we're far from the only community.
No,
They're gonna probably expect some sort of payment in July. So we need to have an account set aside to pay these bills without having to go back through an appropriation process.
So that's a number that's gonna probably vary. It's just right now to put it aside to start.
If you add up into the
Process.
GIC fund, which is the next resolution at F, the town will have about 1.25 million to pay its deficit. I will be up all summer long, growing more gray hair, making sure that this is not going anything past that. And I would like to believe that by the end of the year, we can not have to pay all of this at all. I will note on the next resolution, the GIC trust fund, surplus that's existed for a couple decades, we're gonna pay the first bill out of that, because that account can't be used for anything else other than that. So the first bills, we'll drain that account first at the 251,000, because we can only use it for healthcare. And then the 1 million, I'm gonna ration that as long as I can go. And, I hope at the end there's a surplus, because if there's a surplus at the end, say it doesn't cost $1 million, then we can probably take care of another capital item off the capital list or something like that. But, you know, there's not gonna be an update on this entire issue until I would say around the holidays, until we can really kind of start to breathe and make sure we've really got this down pat and see what the numbers
I think another piece to consider is, we will be covered by Mass Strategic till June 30th. Claims are still going through, so it doesn't mean if someone goes to the doctor's June 15th, it's not really gonna be charged by the end of June, so we're gonna have to pay directly for any claims that come out during that run-out period. So we'll use that free cash as well as the trust account to pay any claims that come in that are processed after June 30th, even if they were incurred before June 30th.
So this $1 million, so you're in the self-insured plan right now,
Correct.
so you pay as you go.
Yep.
So is this a report that you get of IMNA, incurred but not reported claims?
I'm not sure
No,
about the
these are,
acronym, but
these are
It's
claims over the course of, we've been in the group for 4 years. Our premiums have gone into the group, and then we're charged back for every single cost that we have. And that's the current deficit that we have of the cost that we've incurred that we haven't paid for. They're not looking at IBNR at all. This is just actual data.
Okay, so as we go post June 30,
Yep.
what's the estimate for the incurred but not reported?
They don't really tell us that information. We don't know.
Have you looked like at an 8-week average, that type of thing? And will we be recording that in the June statements?
a little over the head here. I
Okay.
mean, I think
So if you look at like,
I just,
as you look at claims, we just heard, you got a claim on June 15th. It's not gonna show up into the system until July 15th,
right,
Correct.
okay? So it's gotta get paid,
correct.
okay? So as you look at, technically at a moment in time, the town's gonna have paying a premium, which is a kick,
Right.
and now you gotta pay the claims that are lagging through the system,
Correct.
all right? So if you look at your claims for like 2 months,
Yep.
which is technically insurances are supposed to pay within 45 days.
Right.
So you figure that's 2 months.
Right.
That's my math. So as you look at that, what is an average of a 2-month claim payments?
They had estimated that the run-out, all in, they're expecting the run-out to be around,
Was it,
I don't
so
have. it on me.
17 million
Yeah.
is the premium, roughly?
Just give me 1 minute, I have some of this data.
And I guess, Kerry, are we gonna try to record that as a liability at the end of June?
We'll continue to process it against that trust fund, against that capital account.
I understand that, but on a recording basis and a cash basis, how much are you gonna estimate for those claims pre-June 30 that are gonna be paid subsequent to June 30?
We don't have a budget for it at this point, we just have to,
You may wanna look into that.
Well, let's talk to
There's
the
only
auditors.
Yes.
We're,
We'll be working with the auditors on that. Consider that.
Yeah,
Yes.
and
Lindsay?
historically, we would use 8 weeks.
sure.
You know,
I'm not sure the strategic health group is as sophisticated as what you're
Correct.
describing, to be honest with you. Like, I
Yeah.
think it's,
Correct.
I think you're going, I mean, I'm just
Very
being,
much.
like, I think you're
Yeah.
in a place where we get we have a monthly meeting. The board is 23 towns and school districts. We get our report, we look at our numbers, we look at aggregate data, we look at our loss runs. We could probably do a 2-month aggregate and get back to you about like what the data looks like. I just don't have that off the top of my head. We'd have to go
Yeah,
back.
no, I
and-
it's
understand that.
somewhere around 600 to 700,000.
is what?
It's been around 600 to 700,000 a month.
So
Yep.
you got a potential liability of $1.2 million.
Yeah, we're expecting, the
not far
high-level estimates are saying we'll probably be at like 1.8 to 2 million in the end.
Just also
after
keep
we
in
do the run-out
mind, the
claims.
last loss runs report was very positive. So we're
Right.
down in the 80s right now, which is a good thing. So we're hoping that that will stick out through May and June. With the pharmacy rebates and stuff, I'm just saying like, your number's not far from, you took another route to get to the same number that I had, about 1.25 million. But that could get better, it could also get a little worse, you know that.
Yeah, no, I fully understand, but my concern is, I don't, the idea of an oops coming next year, coming in in September.
Tom, this is healthcare, there's always
will
an
be,
oops.
yeah.
But you should plan.
This is
for-
American healthcare, I'm dead serious.
I understand that,
I'm
but
sorry,
you should
you know as
plan.
well as anybody, because you dealt with oopses all the time.
But I try to plan for oopses.
Me too.
Okay,
But
but what I'm suggesting is
So-
make sure
I'm just,
you have the cash, you have the cash for it.
so just
and
keep
the-
in
the
mind that
expense.
free cash, when free cash
We're gonna
gets
have to look at
certified
free
again
cash.
in Halloween, if there's an oops, or there's a congressional oops, or there's an income tax oops, right? There's a bunch of other unforeseen circumstances. There is another one-time amount of money that down the road, when free cash gets certified, it's not optimum. I don't want to make people nervous that come November, we're going to have another oops, and that free cash is going to get used this way. But you know as well as I do, it's an uncharted marketplace with variables that are way out of our control. So right now, we're doing the right planning, and we're setting aside the right one-times money that's not having any hindrance on the operating budget. We're doing the right planning now for what we know, but obviously I don't, the
Yeah, but this is-
0.1% that could come, I don't know what to tell you about.
No, and I fully understand exactly all the variables and stuff like that, but what you're saying is that currently in the plan,
Right.
there's $1 million. It could change, but the last number you have, we owe the plan $1 million,
Right.
and that's what this is.
At the end of April, that's what we owe people.
Okay.
Yep.
So as we go into July 1st,
Yep.
and the claims pre-June 30 start coming through, how are we gonna expense them?
We're gonna pay the runout claims before we pay our deficit at all.
You can pay out the run, but
Yeah.
still you have a cash issue
Yep.
coming up, and you have an expense issue. Are you gonna try to estimate that expense for year end, for June 30?
That's what the
No.
numbers
That's
are.
what,
Sorry.
no,
So that's what the two numbers are. So it's the million in the capital and it's the 252
252.
in the GIC trust fund.
No, they're
No,
not.
but we don't have any money left in the benefits budget
Yeah,
to pay that.
They're not, Jen, I'm sorry, but
It's
they're really
okay.
not. This $1 million is there's a current deficit for claims that have already been reported.
But Tom, this is
It's an
where we're
estimate.
missing each other.
Yeah.
You are, just told you, our loss runs in March and April, this $1.2 million that's right there now could be lower.
I
It does
understand-
not include pharmacy
I
rebates, but
understand
you're
that.
telling people that there's a 1.022 million deficit right now. That's in an aggregate at the end of April, but that's not hard and fast guaranteed gonna be there. I'm struggling to get this across. If all of a sudden loss runs in May and June help prevent us from an increased deficit and our deficit can go down, I'm struggling to where we're missing on this one.
I'm just,
I'm,
where I'm trying to go is make sure that we're planning for it. That you have two things going on. You have a deficit that's here, $1 million, 500, I don't know what it is.
we just told you,
Okay,
right?
But now you have-
1.022 million,
yeah, now you're gonna have claims
It's in the
coming
memo.
through after July,
correct.
all right, which aren't currently in any deficit, whether it's $1 million or 500.
Right.
We're not gonna solve this
No, we're
tonight.
not. The only way we're gonna solve it is to get to June 30th and then see where our numbers are at based on the claims that have gone in at June 30th, right? And right now, I'm recommending the 1.252 million to put there across. And you're right, the claims could go further through the roof.
Yeah.
They could. But I gotta handle that down the road. I can't handle that all right now.
Okay.
I mean, I guess the only other option is, if you want to save all free cash, you could do that.
No.
But then if you're spending too much on this and the deficit's lower, then, so one way or the other, what I'm trying to assure you of is when you get free cash certified in November, you're gonna have another pot of one-time money to pay for some of those deficits if they go up, and they go up in a more extreme way.
Okay.
But maybe him and I can talk about this.
Yeah,
offline.
that would be a hell of an idea.
I'll come visit you.
Yeah, sure.
Okay, can I continue?
Yes, you may.
Thank you, I appreciate it. So just a second question, next vehicle, how come we're not using enterprise funds for that?
sorry,
That's okay.
I was trying to answer.
We are, on the dump trucks?
Yeah,
Yeah.
So we are, so I can explain that. So your first round of capital was
Yeah.
using stormwater enterprise funds,
yep,
right? but they're not going to purchase that piece of equipment because it's more than what you gave them. So we're
Okay.
using money from stormwater enterprise funds.
To
right,
purchase that one.
No, to purchase this one.
Oh, to purchase this
We're
one.
not going to use the original capital request. But the money has been given towards it, towards a piece of it. So we're using stormwater enterprise fund, DPW operating budget, and water operating budget to pay for the dump truck.
So not free cash.
So I apologize. Free cash is the 86,000. I'm sorry, I'm
okay.
getting emails, I'm getting text
Sorry.
messages.
Sorry, Carrie.
That's okay. So
So
I
can you just walk me
apologize.
through that one more time?
Sure. So capital round
One,
one,
yep,
stormwater enterprise fund
Yes.
was awarded, and I can't remember the exact dollar amount off the top of my head.
Okay.
For a piece of equipment to add to a truck, and Derek Adams is walking up, you can tell that I
Where
need
is it?
him.
Oh, here it is.
When he got the quote,
Yeah, it was above that.
it was above that.
Okay.
So then they came back to Jamie and I, and they said, okay, we can't do it, but we really need this six-wheel dump truck.
Okay,
So Jamie has the authorization and everything to change. The money is allocated towards capital, but it's going to be towards this truck.
Simply put, like we always
Sorry.
do, general fund, water, sewer, stormwater, when there's a truck that's being used by 4 different departments,
Yes.
we do a split share. I think you know this, because
I do,
your
I'm very
family knows this
intelligent.
well.
My
So just
intellect
for
level
other
knows it.
folks, when you have a truck that's using for snow and ice removal, water projects, sewer projects, stormwater projects, by law, you have to share that cost across. So if you look at the quote, the
Yeah.
86,419 is that quarter share, or roughly about, is the quarter share of the general fund money that goes to buy that dump truck. But the dump truck is not gonna be used for just general fund purposes.
Right.
It's gonna be used by water, sewer, and stormwater, and so therefore, we have to, by law, spread that cost across.
so what's the total cost, I guess? So
280, 330, the quote was in the packet, it was,
290, 979.
330, 350.
Okay, and then what did we
290.
allocate for the first round?
I believe it was 175.
175,
It was-
and then the
so-
86?
If you mean by the first round, the first
capital?
piece of equipment that we were gonna get.
Yeah.
Was gonna be an attachment for, we were trying to take a new approach.
Yeah.
So the catch basin truck that we currently have is it's over 25 years old. So what we were looking to do was, instead of replace the entire catch basin truck with the special attachment, which makes it only a catch basin truck, you can't
Yeah.
you can plow with it, but then you're gonna damage some of the hoses and fittings. So that truck largely sits unless we're using it for catch basin cleaning. So what I was trying to do, and what we were attempting to do, what we have now is called a hook truck. So we were going to get a special piece of the hook fabricated, so that you have think of a smaller dump truck, but you can take off the back piece and you can put on different attachments.
Okay,
So we got a quote for that for 175.
okay, and that was in the first round?
That's,
So
the
that's-
one, yes.
So
And-
we approved the 175 in the first round?
And then I spoke with Jay Stearns, the chief mechanic, and
Yep.
we were like, we need to get this full lockdown, a couple extra steps to get the super double quote, to make sure everything's legit. And when that came in, to everybody's surprise, it was
Yep.
225. And we were like, okay, well, at 225, you can basically buy a new truck.
Yep.
Maybe while our intentions were good initially, with this updated information, it makes complete sense to buy a truck
And then the new
instead of
truck
just
is-
an attachment.
Yep, and then the new truck is 390? 290. Okay.
With the attachment for the upfitting for the plow and the sander and everything like
Okay,
that.
so that makes sense to me. I'm with you.
Mhm.
And that was great, thank you, I appreciate
Yeah.
it. But now that means that 260 has come out of free cash and not an enterprise account, right?
No,
Stormwater is an enterprise.
stormwater is an enterprise account.
Yeah, but if we
The
approved it in
only
the
thing you're
first.
paying out of free cash for this sander, dump truck, plow that has to be replaced because it didn't pass inspection or whatever, is 86,419. That's all you need to pay out of free cash.
So
Everything
what
else
was
is
in
from
the
enterprise
first round
fund.
of capital?
Huh?
I
I'd
thought
have to
we,
go back and look at the.
but I thought we approved something in the first round of capital.
No, not for fleet, for DPW. You didn't.
Oh, I thought he said that's what it said, and when he did the quote, it came in over.
No, it's a piece of equipment, not a
I just don't remember every detail right.
No, I'm not, I just
No,
thought that's what he said, I'm not asking you to
might-
remember every
And
detail.
that's what I clarified, he asked for a piece of equipment, this is not the truck.
So what do we use the
Now we're looking for a
175
truck.
on?
Thank you.
I think that's all we're asking. Like if we
This-
had 175, we appropriated to something. We didn't buy what we appropriated it
So
for.
now we're
What did we
appropriating
buy?
to a six-wheel truck.
But then, like, is the truck
Go ahead, Linda.
175 plus 290?
No,
So
No.
that's what this
that's
looks
why
like.
the quote's in the packet for
It
this.
doesn't look nice.
Well, then why do we need to pay 86 more?
Okay, I'll try to simplify
Thank you.
this for you.
Thank you.
So we appropriated 180, you were really close.
Okay, 180.
It was
round one.
180 in
180.
round one,
Okay.
for that piece of equipment that they thought they were gonna get,
And we said no, thank you.
said no thank you.
Correct.
So never spent that money.
Great.
Okay.
Now they said, okay, we want to, like what he just explained, they want to do this instead, and we're going to split it. So the 180, they're going to use through Jamie's approval.
Yeah.
And now DPW is going to put in 86 towards it, and then operating for water is going to take a piece of it. So when you add all those little pieces up, it's going to come to the 290.
And the 86 is from free cash.
Right, only the
Remainder is
86.
from water and operating.
Sorry, we just
Right.
got right back to the same endpoint, right?
But
So
it's
you
not-
had
It was
180.
very, but
You want to buy something for 290. There's a $110,000 difference.
Right.
Who's paying the 110,000? That's-
86 is coming out of DPW free cash, and the difference is coming out of water operating.
So free cash is paying
86,000.
90% of it, is what we're saying. 85%.
No, really, stormwater's paying the 180, 180,000.
Majority of it.
It's like we need
Stormwater
round one.
enterprise fund.
I'm trying to find round one to see if I can
But,
like.
sorry, that's in round one. Like, I'm talking about the 100, so round one is done.
no, it is done, but Jamie has authorization to take that fund.
Sure.
Right, they
and now-
reallocated.
So then if you
Like,
understand
ignore
that, then
that.
how am I
Ignore that.
seeing it?
So it's a $110,000 additional amount needed. That's all we're asking about, right? Is like, of the $110,000,
Yeah.
like, who's paying that? And the answer we just got was free cash is paying 86,000 of the 110.
And then water,
And then water.
Yep, is paying what, 30, 20?
whatever the difference is.
Is it the water operating budget?
The enterprise.
There we go.
Guys, you're all saying it like it doesn't, it makes so much sense, but it doesn't. Like, why would, you're saying split 4 ways, but then it's not. It's.
Can I
it's
ask a
split
question? Maybe I
2 ways.
missed the first round of capital. So when we did the first round of capital and we appropriated the 180, I don't even care what it's for, right? Ice cream machines in the cafeteria, I don't care. So we appropriated 180 for capital, right?
Yep.
It came out of free cash, correct?
Retained earnings,
Yes.
because it was for stormwater.
So that was what I'm asking. So it wasn't part of our capital, it didn't come out of free cash? Our
Right,
capital.
not out of general fund free cash.
That's what I'm asking.
Right.
Okay.
It came out of the enterprise retained earnings.
That was the confusion.
But I said stormwater enterprise fund. That's what the capital request for. Yes, it was paid out of enterprise fund. It's stormwater, it's not
Right.
water.
No, but it wasn't in our round one capital free cash.
It is, it's in the second.
It's in the retained,
second-
it's a separate resolution.
It's a separate resolution.
Separate resolution. It wasn't embedded in the first round capital.
It was still part of your capital process that night.
But not out of,
Yeah,
yeah,
it
but
was
not
out
out
of
of
the
free
enterprise
cash.
fund.
Correct, it's out of
Right,
retained
okay.
earnings.
Okay.
So then there's
Okay.
3 groups paying, not 4, right?
Correct. This situation is only the 3.
And so one group is paying 180. One group, free cash, general fund, is paying 86.
Correct.
And then a third group is paying water.
Water enterprise.
Water
Correct.
enterprise. is
Because
paying
it's
30.
being used for general purpose. That's why it's in this account.
It's going to
Yes.
primarily be
Be
used
used
for
stormwater.
stormwater, but during the wintertime, it's going to plow for sure. That's where some of the extra costs came from. And then the water department, it's just, we have interchangeable trucks that you never know what you need it for. If they need it for a day, they're going to have to grab it, yeah.
Okay.
What department is missing? If there was 4, and we've just
Sewer.
named 3.
Sewer.
Sewer, okay. And sewer doesn't have a dog in this fight?
Put down with the catch basins.
Right, wasn't that the whole original point?
I
was
don't know.
catch basins?
I'm not asking any more questions. Yeah, wasn't that part of the beginning?
No,
That's the stormwater portion. Storm, so it is kind of complicated, because people call, not you guys, just in general, people will state the storm sewer system, which means the roadway drainage. And then the sewer system, exclusively sewer, is closed, contained, you flush your toilet, nothing enters it except that wastewater, and it goes all the way to Medway and gets treated before it gets discharged into the Charles River. 2 completely separate, not
Okay.
connected systems. So stormwater is roadway drainage.
Yep,
Sewer is flushing your
underneath,
toilet,
yep, okay.
washing your clothes.
So this truck won't help us with sewer at all, is what we're saying.
So,
I'm good,
Oh,
I'm
right.
good.
Just want to clarify.
No, I'm good, I got it.
No,
It's just
we should
parts.
be questioned.
No, it's just-
We can ask questions, it's okay.
We just do different parts when we do it. So if you think about the infrastructure system, the road makes sense because we have to use the truck to plow, okay? Water, we have water breaks, it's under pressure, you see us digging up the roads, okay? Sewer, that really doesn't happen. We're not digging up sewer lines because it's a non-pressurized system. Most of that we use like the Vector truck for, so like that truck would be almost 80% sewer, and we use some for water because we have to clean out and stuff like that. So we, by law, as Jamie said, we have to break down the use of the truck per funding source. So every vehicle has a different percentage on it.
That makes so much more sense.
Okay, thanks.
That's why I asked you to get up.
Nailed it.
I don't understand.
Can you share that with Lee?
What?
I understand.
Oh, you don't understand.
No, it was my misunderstanding, because I thought it was in the first round of capital, free cash capital,
Right,
not
in the
enterprise.
general fund,
General
free
fund,
cash.
exactly.
And
That's what I was
Sounded
confused
like
about.
we were double paying.
Right,
Yeah, okay.
all right. I've got one more, and I'm gonna try to make it a quick one. I
You
don't
don't
know.
have to make it quick, it's fine.
No, I do, this is torture. Can you just talk to me about what the Parmenter code review is?
Yes. To do a review of the code problems in Parmenter, so that either the council can make a decision on how to reuse the property. Is there investments that have to go into the building? There will be, because there hasn't been a code review probably on the building ever. You know, it opened 77 years ago or whatever, so in order to know what's inside the building, what needs to be done, what's out of code, whatever, whenever they built it in 1950, the code is different now, so you have to go through at least some sort of documented, this has to get fixed, you have to modernize this, you have to do that, you have to do this, and so it costs some money to be able to go through with that. At some point, if the town wants to reuse it, repurpose it, reuse it for the police station, don't build the police station, leave it alone, sell it, whatever their decisions are, lease it.
Yeah.
At some point, you've got to do that code review to be able to even if you lease it, you've got to do some sort of code upgrades, because the building should, if it's going to get leased out to another person,
Yeah.
or whether you're going to sell it, you're going to have to do that code
So,
review at some point.
Thank you, I appreciate that. My actual question, though, is more about if, I don't.
So I didn't answer your question?
No, you did, but that's not really where I was going with it, that's why. But it
Okay.
was great. My
What's the
question was really more about that we use the building.
Yeah.
So like seeing something that says a code review when we have people in the building, right, makes me feel uncomfortable. So,
We had children in it for 75 years.
right, so that's why I'm
And, you know, so
wondering,
at the end of the day, we only have municipal employees in there right now.
No
You know,
kids?
we're gonna go
We
out
don't
and
do
do
any-
some sort of, no, we have kids, but I'm just saying, like, at some point when
It's
it's
really
not
kids.
used for municipal purposes, you have to do some sort of review, because
no, I
they
know,
tell
but
you
I'm
that
worried about the safety piece now, like how come we haven't done this? You know what I'm saying? Like we have people in the building and we,
if you want, we can shut it down.
no, I'm just wondering, I'm asking a question.
Well, I'm answering the question. I'm just saying, like, at some point, if you're gonna sell it, if you're gonna lease it, if you're gonna do something with it, you know, at some point, we have to get some sort of architect and design, and engineer in there
Yeah.
to look at all the stuff.
But
So
I also appreciate having it done for the safety of people who utilize the building,
that doesn't
right?
necessarily mean there's anything unsafe in it.
So going the other way.
I mean, I
like,
guess,
Does the code review depend on usage? Like the codes that are applicable, if we do that now in some general sense, but then we were gonna rent it out to one group versus another, doesn't the applicable code vary based on what you would use it for?
it does. It certainly
Okay.
does. But even beside that, you know, the schools owned it for all that time. I guess the reason why I answer it the way I do is, I'm just very nervous that we're going down a rabbit hole in a labyrinth of wondering to ourselves, well, if we're worried about kids, then why did we have kids in there for so long? And I guess
Well,
I'm just
you
wondering
see
where you're
safety.
going with this.
I see safety and I'm wondering why we haven't done it, that's all I'm asking. I'm not going, there's no
We're asking
rabbit
for the money
hole.
to do it. We just, the rec department just moved in there last year as a the rec department, by the way, moved in there temporarily because of the noise at the Beaver Street facility with the rec department because of the Beaver Street Interceptor project. And I'm sure Ryan would be more than happy, I know he was here earlier, I don't know if he left, but, and obviously it's worked out really well for some of their programs and stuff like that. So, getting ready for whether or not we're gonna renovate it, use it as a police station, not use it as a police station, leave it for kids, whatever it is. I think the building is very safe, but I think I don't know, I'm a little just shocked that the conversation gets to this point where we're just worried about the building so much that that's not really what the point of this is. The point is to get a documented architect in there to be able to document exactly, not necessarily what safety problems are there. There probably are safety issues that are gonna be in a building like that. Any building that old is gonna have a couple issues, just like Davis there. And so we just wanna get in to get a clean slate of what exactly needs to be done in that building.
It doesn't mean that there's anything unsafe in that building right now. Just because we want to do a review to make sure that
When was the last
should-
time one was done? Do you know?
I don't know if one's ever been done.
Oh, okay.
So it's a
But it
structural, it's a structural review more so than a code, is it?
Could be fire alarms and
Fire
electrical
alarms,
systems
steel.
and anything. But but the point is, there's nothing wrong with the building right now. We just want to make sure that if, in the reuse, whether it be Chief Lynch's people or Charlie Brown's kindergarten moves in there, that, when that happens, it may have to be upgraded. And we should know ahead of time to plan for it. I think that's all it is. I mean, we're not even insinuating that the building is unsafe.
Yeah. I mean, maybe the
Just
building
not.
commissioner or Kevin wanna add something in? 'cause
I
they're-
didn't insinuate that the building was unsafe, first of all.
Well,
I just
well-
asked a question.
I love buildings.
And you
Well-
all went on a tirade.
No,
No.
you did a little.
No, I said, what is it? And you told me
You
it was
said,
to
why do
check
we
the
have people in
codes.
there if it's unsafe?
Because you said it was a review to make sure the building was safe. And I said, oh, okay.
Good evening, Gus Brown, Building Commissioner.
Hey, Gus.
Hi, everyone. 28 years of doing inspections in that building. We did it yearly. Children are in it. There's never been anything that was a red flag in that building as long as I've done it. Things change, things happen, but I can go out there and do an inspection tomorrow. If that settles this right now, or is it more in the future as to how the building is repurposed? And if it is repurposed, a change of use will promulgate an architect to do a review. But until that time happens, I have no problem with the building, the way it sits right now. I don't know if that answers
Kevin?
the questions or not.
Kevin Harn, Director of Facilities. Still test and maintain the generator, test the fire alarm system. We do roof inspections. I guess maybe currently right now, out of the 2 domestic water heaters, one's down. I don't think it makes sense to, until we figure out the use of the building, we still have, a heater. We still maintain the boilers and everything. It's not that we're not maintaining the building either. It's still.
So sorry. Gus, you've inspected it within the last couple years, let's say.
We have, with the fire department.
And Kevin, you're saying you still fix stuff at the building.
I still what?
Kevin's saying he
Oh,
still
I'm
fixes
sorry.
stuff at the building. We want to do a review, but we don't know what the building's going to be for. What would be the purpose of that review until we have a prospective use laid out so that you could then, I honestly don't know the difference between your inspection and a code review in terms of what you might find. I'm getting hung up on the why
Sure.
would we do this if we don't know what it's going to be?
The only reason for a code review is if someone repurposes it. Right now, the way it sits, no. Is my opinion. Doesn't mean you
Sure.
agree with it, but that's just my
That was
opinion.
where I
We
was
agree with you.
headed as well.
We agree with you.
I'll give you an example, I don't know if this is appropriate for it. I built an ED, and the plan was to build up on top of it.
Sure.
15 years later, we wanted to build on top of it. Codes changed, so we couldn't do it. But the intent as we were planning to build on top. So now we couldn't do it, unless we had to restructure the base, so to speak. That's what I think this is, to kind of look at what's there and what code changes there are to do major renovations to the building. Is that what I'm hearing? That's what I understand it to
I
be.
really feel confident I said something like that at the beginning about the future use of the sale, the lease, the
Yeah.
reuse of the parcel. I think
Yeah.
that's exactly right, like,
You did.
this wasn't about, I'm sorry, I
wasn't about
respectfully disagree,
code.
this wasn't about safety, I don't know where, I've been looking for the word safety in here, I don't know where that came up.
You said it, I didn't.
didn't say
I'm
it.
gonna go back and pull it, because
I'm
I didn't
looking-
say
I'm
it.
sure we're all gonna go back and
Yeah.
pull it, but I didn't.
I think the word code.
I'm not.
All I said,
Absolutely not.
all I asked was what was it?
I
'Cause
said it was about the future use of the
All I
building,
said
like-
was I didn't know what it was, and you said it was to check the safety systems and the codes that are in the building.
Okay.
And then I said, oh, well, that sounds like it's a bigger issue.
For the record, in January, the police station, and excuse me, Steve Sherlock, 13 Magnolia Drive, Community Information Director, Franklin Madison. I forgot to say that a few other times. But in January, the last police station building committee made 2 recommendations: to use the Parmenter property for the police station site, and there's been an executive session, town council still is that under executive session. The second recommendation was to do a code review, so that it would be part of the process, as the administrator announced, to do further planning, because if you go back to that January presentation, you could use part of the building or all of the building for other purposes and still put the police station building on the property. So in order to, as Gus and Ken indicated as well, to understand what's in the building, you need that code review. It's just preparatory and good information. So that was my recollection from the January meeting, Police Station Building Committee. Video's available, my notes are available. Thank you.
Just
set.
one last comment on it. Yeah, I just want to comment that I appreciate this actually review as someone who has advocated for making a decision on Davis Thayer and getting it used as quickly as possible. I want this building used as quickly as possible, and if this helps it, great.
Okay. Are we ready for a vote?
I just have one question.
You know that explosion over the water? Well, when my head explodes, it's gonna be,
Just for my clarification, because I wasn't here for the entire year last year. So for the truck, the 86 is added to the first, is an addition to the first vote, correct?
yes. Okay.
Can we just go through the balance of like, what do we have in free cash right now?
If you assume the 1.1 million used in the budget,
So, sorry, before we start assuming things go places, what is the like,
well, you,
today balance? And then we can assume where pieces go.
oh man, okay. You guys are killing me on that. So you add the 1.104 million that's used in the budget,
Okay.
and add that to the 1.528919 on this resolution. Whatever those two numbers add up to is the remaining amount of free cash, so 2.6.
So
Some
this
change.
proposal is to use all of the remaining free cash.
Every dollar.
Okay, that's where I was trying to get.
But remember, that includes obviously the tier 1 capital that you already approved, the 1.8 million or so earlier. So the amount of free cash you had this year was like 4.5 million.
Sure.
Right, so 1.8 of that roughly was already spent.
You're right on.
Am I on?
Yeah.
Yeah.
Yep.
So the remaining cap is 2.633051. $2,633,051. Less 1.1
For the 27 budget.
for the 27 budget,
And 1.6 for this.
and
Did we not-
1.528 for this, yep.
Did we not certify another round of,
No, that won't be till November.
that only happens once a year, this is just a
Correct.
repeat of the same, okay, my misunderstanding. I thought there was a recertification, so this is just a second bite of the same apple,
Correct.
use the rest.
Correct.
That's why we kind of refer to them colloquially as round 1, round 2, round 3 if there was one, as you go through the appropriation.
And one technical, the health insurance deficit payment, why is it under a capital improvement plan? Shouldn't it be its own separate vote?
No, because it's just using I mean, you could But there's no reason to do that. It's just, you do one vote, and it's going into the same type of account from the same source of funding.
Yeah, no, I understand, it's just the title of the health
Sure.
insurance.
Okay.
On the teacher laptop replacement, I know we talked about, round one, I remember there being a robust discussion.
Correct. Actually, I just pulled up round one. I asked them to anticipation of a question.
Yes, somebody likes questions here. It's not many people in this room, but it is Carrie. Carrie loves it. So when we did that first discussion on the laptops, and there was a lot of, I don't want to put words in your mouth, but I believe there was a lot of discussion about how they're just like, it's a constantly revolving need.
Yes. So Tim Raposa, Director of Technology for the Franklin Town and Schools. So what you're referring to is how laptops wear out, right? So these are 5, 6, actually they're 6 years old today. And if we don't replace them, yes, the teachers will be using 7-year-old laptops. And really horrible, all day, every day, doing presentations all day, every day, 6 hours a day in your classroom, 300 people. 330, I ran the numbers exactly right before I came here. Yes, it is a repeatable, as are Chromebooks, as are police cruisers, as are lots of things that are paid for by capital, but not in regular budgets. We don't move them into regular budgets for lots of reasons that we went over last time. We don't want to rehash all that again. But yes, that's where we are. We need 330 at about 1,100, 1,150 each. You can all do that math. This covers maybe half of what we need. So that's where we are. If that answers your question.
And this is just for teachers, and then the round, the first
Just for
round we
teachers.
did was for the kids?
That was Chromebooks.
Chromebooks,
Chromebooks,
right?
not laptops. These are laptops, Windows
Okay.
laptops. Chromebooks was the $100,000 for the laptops. Chromebooks for the students. Every year, 6th graders get new Chromebooks.
Okay, thanks.
All right? Any other questions?
Yeah, yes.
My questions about round one, the biggest expenditure in round one was $750,000 for the senior center roof sprinkler system, if I remember correctly, somewhere around there. I was just curious, I know this kind of doesn't have to do with this, but have we started that project? That number sticks out to me because it was almost 50% of the first round one. And I have been curious if we're coming in on budget, if it's under, if it's more, I was just curious about that number in general.
Curious about the $750,000
Yeah,
number?
if that was actually true is that looking like it's actually gonna be the true cost of that repair?
So we don't know yet. We just received some qualifications and proposals that came in. We developed an evaluation team. Evaluations will happen over the next week or two. Once we go through the qualifications, the team selected will identify our first, second, and third choice on who we want to work with. And then we present those to Jamie. Jamie will then conduct interviews interviews with our first choice, and if Jamie can negotiate a price, great. And then if that engineer is selected, they'll develop the system and also develop a more constructive price how close we're going to be to that $750,000 number.
Okay. We're not there yet. Okay.
On an equally same conversation, but not this number, we now have nothing that I've heard in our budget conversation or this held aside for that, what was it, the $1 million fire truck that we need to pay for? What is the proposed plan there? Like, if we're emptying the savings account here,
That would be next year's discussion. That would be next year's free cash discussion.
okay?
The band money for the borrowing is in the amended budget.
Sure.
It's in one of the notes.
The interest.
And we can, as we said before, we can band it another year. We can look at what it is next year. We can pay off a portion of it. I mean, I think that was an open discussion that we kind of acknowledged back when we did.
So I don't have to pay it off in fiscal year '27.
Okay.
So we typically will start having that discussion, and I will give you a balance of what's in the fire truck stabilization account. We will come with the general fund free cash numbers. I don't know why I'm looking at Linda, but free cash is Linda. So, and we will come we'll give you a recommendation, say we'll pay this all off, our debt in cash. We'll do another borrowing, if we're doing a larger borrowing next year, which I highly doubt at this time. Or we have multiple things, and we'll come to you in a recommendation after I know free cash numbers in the fall.
Okay, it's short of a larger borrowing.
Sure.
If next
Yeah.
year
Yeah.
played out the same way this year did, and we started with 4 million or so.
Sure.
Like, the fire truck would effectively either have to be kicked again by paying some amount to kick the can another year.
Yes.
Or, like, the sprinkler project for the senior center was our big ticket item this time, it would be our big ticket item, and we have no
It
room
could
for
be,
other.
it could be.
Because like, the rest of our capital budget goes to recurring expenses. Cruisers, tasers, whatever else, like, boilers, things that we are always gonna need every single year, some of. So, like, we aren't really making like capital investments with that money at all.
That's correct.
We're just like keeping our head above water. And we would be saying like, if anything unexpected happens next year, then we only have the option to kick the can on the fire truck.
Correct.
Is that?
Or you can use.
Pretty accurate.
Yeah, just making
But
sure.
I think your
I'm not gonna-
statement is actually more of a global statement about what we've talked about for a couple of years, right? I mean, I think the veteran members have heard this for a while, but I think you're right, Ryan.
I guess where that.
Brian, we
needs
could
to be-
also pay a portion of that next year as well.
Yes.
Like some amount of principal, and then you have less that you're pushing forward to future years if we continue to do that.
Sure, yeah, good point. I'll say personally, that makes me uncomfortable with spending every dime from our savings account today, but I don't know how others feel about that.
Well, I don't consider free cash a savings account. I consider stabilization accounts savings
Checking account,
accounts.
checking account, sure.
Yeah, you know what I mean? It's
Okay.
not, unfortunately, it's there, and if you don't do it now, you'll do it next year. It's not gonna change from free cash, unless we move it to a stabilization account for a fire truck. There is money, 113 or something like
Well,
that.
there's more
No,
than that.
311.
There's 300,
Yes.
above 300,000, but both, I think the committee here and the council recommended to not use that.
But there are gonna be
stabilization money.
other fire trucks,
Right,
guaranteed.
sure. Yeah,
So-
good clarification. I said savings. I meant checking. Personally, I don't let either of my accounts go to zero, but this is suggesting to bring our checking account to zero.
So we do that every year,
Yeah,
and the
I
difference
know.
is typically we move money to savings accounts. So typically you take your 4.4 and you use capital
Sure.
and you throw money back to all the stabilization accounts. This year we can't do that, and we're using some for budget deficit, but we always zero it out. So the question would be, if you're uncomfortable with that, would be making a recommendation to move money to savings when it's like, we have other fires this year, unfortunately.
Have we ever not?
I guess that's the history,
I
don't
think
know.
you have to use, free cash, what do you do, what happens if you don't use your free cash?
If, on June 30th, if you don't use free cash, it just then you have to, you can't use it after July 1st, and then it goes and gets recertified into the number in October.
Like, just rolls to the next year,
You
right?
could, but you could, like OPEB, have a policy down the road where you want to set aside a percentage of free cash or a raw dollar that goes towards some sort of savings accounts, checking accounts, stabilization accounts. Here's the problem with that entire problem, and I think Natalie and Lauren are speaking to this. We're in the same exact situation every year, and then we say, well, we need Chromebooks, we need laptops, we need boiler replacements, we need tasers. And so then the department heads say, well, if we don't fix these projects, then we're gonna fall another year behind. So, it's not necessarily an uncommon practice. I think most cities and towns use all of their free cash every year for something, and they go to zero, right? Because there's always needs to be had, and so I think there's never been much of an effort to try to stash a lot of free cash away for other stuff.
So totally understand what you're saying. The only amendment I would suggest is that it's not the same every year, it's getting worse, because I think as we just said, some years we are actually moving things into savings accounts. This year, we are not, which to me is like a notable step in a worse direction than if we were saving something, but we're saying we're saving nothing. We have a $1 million fire truck we just bought. We have probably we definitely have Chromebooks that Tim's gonna ask us for in 6 months, right? Like, we have all the recurring things.
More laptops,
And the rest of the laptops, right? Like, the expenses are the same or more, and we are not saving anything towards them. That's the.
You're 100% right, and as it was acknowledged early in this budget process, and, I mean, this is I think elevating that point up to a bigger 30,000 foot, these are the consequences of the override failure. Because if the override didn't fail, the $1 million you'd be using in the budget, you would have just paid the truck. So, one way or another, and this is, and I'm generally serious, because I think over the next couple of weeks, this community has to start talking about these issues, not just in the context of a failed override, but, do we want to cut more out of the budget? Right? And I think generally the public has responded in a way that the cuts that were made were unpopular. So we're now trying to restore positions, right, which we don't need to. But whether it was the firefighters, the part-time nurse, school cuts, the library, it doesn't matter. Like, whatever, the DPW has been cut 800 grand over the last year. So service requests are still going up. Like, and I just think that we have to, at some point, realize that this is a very good discussion, and your point is extremely well taken. The math is not working out all the way to stay on top of all this. But we're also not having the uncomfortable conversation that if we don't want to restore SROs and an assistant town manager and other positions, and if we want to reduce the services in all of our departments, fire, police, schools, and everything, I think we need to do that. Because if we don't, and we want all that in the operating budget, then we have to pay free cash to do it.
Right, we can't do both.
So we either can't have it all, but I think also we're avoiding some very tough conversations about the size and scope of what we want the operating budget to be like. And I'm not saying you guys are avoiding it necessarily individually or as a group. You guys had a great finance committee, process and discussion this year. But I think we're stuck in a doldrum of where do we want to go here? Because to your point, Ryan, you're spot on. Like, we are just kicking the can down the road on a couple of these expenses. As every department will tell you, the capital requests are getting backed up too. But it's also unpopular in the community for an override, but it's also unpopular to make the cuts as a consequence of the override. And if I knew the answer to that quagmire, I would have already suggested something. So I think unfortunately these are some of the symptomatic problems that we're having as a result of a failed override. So I mean, and these are some of the symptoms that come with it. So we're struggling to make ends meet on all these things, and it's a hard conversation to have. But I think these are symptoms of what happened last year.
I guess with that, personally, I would prefer to forego the Parmenter code review study at this time, kick that can instead, and move that 62,000 into the fire truck stabilization fund, knowing, like, it's a known versus an unknown.
Agreed. Didn't we have this discussion last time about, and it was real wonky, about how to take something, or how to recommend something, and then we had a vote, remember, there was a big fight?
I think Mr. Wonk is living here.
No, I just don't remember how we decided the process would be.
I think
agree
because
with
we already
Ryan.
made the motion on this one, we have to vote on it. I think you'd just vote no, and then we'd have to make another one to vote for it without it.
You would make an amendment, is what you just said. You would say, I make a motion to make an amendment to replace the code review, right? And then you'd have a vote on that of the finance committee. If that got approved, this would change the recommendation for next week before the council.
Okay, so then I would like to make the motion to amend Resolution 2633 to remove the Parmenter code review study line item for $62,500 and add a line item to move $62,500 into the fire truck stabilization fund.
Second.
Is that wording correct, guys? So we
Yeah.
vote on the amendment first.
Okay, we're voting on the amendment first.
On the amendment to, as Ryan said, move it from a code review to a fire truck. Fire truck stabilization.
Okay. so this is on the amendment roll call. Okay. George,
Yes.
Natalie,
No.
Chris,
No.
Lauren, I'm gonna say yes. John,
No.
Ryan,
Yes.
Shannon,
Yes.
Jennifer,
Yes.
Tom.
No.
So that's 4 no's.
5-4 is approved.
Yeah.
Yes, had it.
5-4,
Okay.
yeah.
Yeah,
That was
majority
approved.
vote.
Majority vote.
All right, so now what about?
Now the
That's it.
original
Now the original.
motion as amended.
Wait, I don't understand.
No, it's just
Original motion as amended.
we already have it on the floor. It's been amended, so the vote is on the original motion as amended, that's all. Just semantics, I think, at this stage. Right? No objections from the peanut gallery, so I guess that's what I did. So it's a vote on,
So we vote, exactly, tell me again, because I'm confused by the language.
can we move the money from, on this resolution to a stabilization?
Sure.
Okay.
You can move, you can absolutely deposit. What we will do is, for the council, we'll set up 2 resolutions, because the stabilization one will be separate, but for the purposes right now, because you're making a recommendation,
All right.
it's not as legally
I just want to
binding.
make sure we don't get Mark upset.
No, he's gonna tell us that anyways. No, we would have to split it, we'll split it up for them into 2 resolutions for sure. Because it's stabilization.
To transfer.
But for our purpose, it's, the amendment's been approved.
Correct.
Now, the motion as, the original motion as amended is now up for a vote. Correct? Yes.
Okay, George,
Yes.
No.
Natalie,
No.
What are you voting on?
We're basically voting the same thing. We had to amend it, and then we're voting
You're
whether
voting
or
on
not we
the-
recommend it
The
as
larger
amended.
resolution.
yeah,
So we're-
okay,
we're voting on the whole now, as amended.
yeah.
The original motion as amended, so in effect, we changed the wording from code review
It's the
to
same
fire
thing.
truck.
Yep.
That's it.
Okay,
Unless you have other adjustments.
Right.
Correct. To
Okay.
Ryan, yes.
So like, if you, just before we continue,
Mhm.
if you have other adjustments you want to propose, you should do that now, before we continue this vote. If you don't, we're just voting, do we want to do what this says, except the 62,500 goes to the fire truck stabilization instead of the Parmenter code review study?
That is correct.
okay, all right, so George was a yes, Natalie was a no, Chris,
So just to clarify, there's no vote on the original resolution?
correct.
Okay. Yes.
Lauren, yes. John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer,
Yes.
Yes.
Tom. Okay.
And there's no, just so everybody's aware, there's no, now that we have another 70, 60 something in the fire truck, that commits it to the fire truck now. You can't
That's
move it
correct.
to somewhere else. You can't go back and do a code review. Okay.
Correct.
Yeah.
And
We
the
just have
town
a
council still
recommendation.
votes on this.
We just have a
Yes,
recommendation
yes,
for that,
yes.
we don't actually have that. It
No.
doesn't
Right.
get
No,
transferred.
they-
The town council is.
And then the town council could,
Do
it
something.
votes
They
on
could
it
do
either
whatever
way,
they
could
want.
revert back.
They
on
could do
things.
something
Yeah.
totally different.
Okay.
Yep,
Great.
And was that roll call vote on the final resolution?
Yes.
Yes.
On the 1.528 million?
this
As
one with the
amended.
change. Okay,
What was the 8-1?
all right. What do we got left?
This is hard.
Appropriation.
Robert's rules are valuable. That guy spent too much time thinking.
This one hopefully should be easy because we've kind of discussed it. Okay, so motion to recommend resolution 26-34, which is to move 437,000 from a previous group insurance trust fund into the reserve for the liabilities for the current health insurance plan exit.
So moved.
Discussion? Seeing none, away we go.
All right, George,
Yes.
Natalie.
Yes.
Chris,
Yes.
Lauren, yes. John,
Yes.
Ryan?
Yes.
Shannon?
Yes.
Jennifer?
Yes.
Tom?
Yes.
Okay, next up, motion to recommend resolution 26-35, which would transfer 440,000, 220,000 from the ambulance receipts fund into, in order to purchase an ambulance from the fire, in order to purchase an ambulance. So it's moving it from the ambulance receipts into a fund to purchase the ambulance.
So moved.
Do we know what the lead time is now?
Yes,
24 months, that's why we're here. So,
Okay.
and obviously they're very
the
busy.
good news is, no injuries at the
Yeah.
fire. The fire chief just literally texted a second ago. If he were here, he would tell you that because the lead time is 24 months on an ambulance, the money is already set aside for this. We already have it because we take out about $125,000 a year, like the stabilization fund, out of ambulance receipts to put into an ambulance account. And he came to us recently and said, the lead time's 24 months. You already have the money to do it, you know, we gotta put it in order soon. So that's really why this kinda came out. This was on his FY '27 capital plan, but with the lead time now at 24 months, you know, I think they wanna put the order in.
We're actually running a 2014 ambulance at the moment.
Right.
So we have
And
one,
No,
No.
We have 5.
5 ambulance, and this would put us at 6, or
No.
will we be
No.
retiring?
I'm sure it'd
one?
replace
Okay.
the oldest. I'm
It's
guessing.
actually, the backup does say that, I believe it's, this words are escaping me.
yeah, he wrote a whole memo.
Yeah.
Oh, yes.
But actually,
Yeah.
yeah, it's a trade-in, sorry.
Yes, perfect.
Thank you, sorry about that. And just for discussions, we understand what the ambulance receipts reserve fund is.
Thank you.
Great follow-up, though.
Anything? All right.
Can you explain that, the fund?
Sure.
So ambulance receipts come in for ALS, BLS calls. The predominant majority of that goes into local receipts. But we have a policy on the books that takes out a certain portion of that every year to set aside in a stabilization account. Not the same type of stabilization accounts as the fire truck, but we're allowed to do this for the ambulance. And Linda sets it aside in each year and accumulates on a 3 to 4 year basis, which is usually the rotation of an ambulance. So the ambulance lifespan is usually about 3 to 5 years, unless you can rehab them, trade them in, and some other, some of those other details. But that's how we've been able to replace the ambulances year after year, is by recycling the money that's being used to go pay for the ambulance.
So
And just for
self-sufficient.
clarification, in all due respect, it's receipts reserved for appropriation fund, it's not a stabilization fund. But again, it can only be used to purchase an ambulance.
Okay, so that program, if you were to look at it as a whole, is self-sufficient.
I
No,
say
it
yes.
isn't. No.
How?
No.
They like how staff they pay, like
Oh.
the
Oh,
ambulance
I'm
itself,
sorry.
yeah, but like the,
Well, with the receipts, the entire receipts
Sure.
of the ambulance pays for the, correct me if I'm wrong, pays for the ambulance, the personnel,
Not the person.
not the personnel.
Pays for 100% of the ambulance and about 35% of the department personnel. It does not pay for 100%, not even close, and it won't ever.
And every year the rates are looked at and increased. In fact, the town council just did increase it.
The ALS, BLS rates.
Okay,
Okay.
no further discussion?
Okay.
Onward.
All right, George,
Yes.
Natalie,
Yes.
Chris,
yes.
Lauren, yes. John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer?
Yes.
Tom?
Yes.
Okay, motion to recommend resolution 26-23, which is to appropriate from the Community Preservation Reserve Fund as per the recommended amounts from the Community Preservation Committee.
So moved.
Discussion?
Anybody
This is
need
just the annual
clarification?
budget.
Yeah.
No.
So where's this money come from?
The community preservation and your property tax bill, the 2%.
Separate line.
Okay, so it's a separate fund, and that we're moving the money.
Yes, so this has to be brought to the Community Preservation Committee first, and they have discussion, and then it goes to the Finance Committee, and then the final vote is Town Council.
What's the, like, if there was a no vote, what happens then? Like, this is money that was paid like specifically for this purpose, right? Like, it's a tax for this.
So this budget is really not a no vote, because these are all, the allocations are all required by statute. So you have to spend 10% on open space. So these are just reservation accounts that we set aside to make sure that when we report to DOR, that, you know, that you have to set aside 10% for those categories. I guess if you voted no, and the council voted it down, we'd go back to the CPC to take some sort of feedback to say, well, why are you voting no on something that's essentially mandated by state law? We're just putting right. I will say on the project slate.
The next resolution.
Hold that till we get there.
You got it.
On this one, it's effectively a rubber stamp of like, we're following the law.
Right.
Yeah.
That's like, do we want to follow the law, yes or no? Right, that's what we're
That's
saying.
a loaded question.
On
I
this,
think there's some people here that would say no, right?
On community preservation, not every law,
Right.
just this one.
Breaking the
Okay.
law, so
All
yeah.
right, that's
On
fair.
community preservation.
We're
You
not
can
the
drive over the speed limit if you want, just this.
Correct.
Did I say that?
If you get caught, then you might get a ticket.
TJ left, so you can do whatever you want.
He's already come.
Okay,
No further discussion.
all right, George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes, John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer.
Yes.
Tom.
Yes.
Okay, so on this one, motion to recommend resolution 26-24, which appropriates $2,989,140.58 to the listed projects as recommended by the Community Preservation Committee.
So moved.
So this is, we moved the money there, now they're saying this is what we want to do with it?
This is what they're spending it on.
Yes.
Can I ask one question? Can you just tell me where the murals are?
Yes, at the library.
There, that's what I thought, okay.
Yeah. Actually, yeah, in the older part. It's
Yeah.
amazing.
Thank you.
Amazing.
Yeah.
Yes.
Well, we
900K.
moved 2 million.
We moved 2 million in the
They
total.
must have some reserves.
Yeah.
Correct.
Okay.
In the packet that was in the attachments, it shows the budget surplus from accumulating money through the year. And, so, yeah, correct.
Okay.
And obviously, they, did not recommend the Maple Hill project, which is why it's redlined out, and they recommended the $250,000 to the Franklin Affordable Housing Trust.
Is that, I'm unfamiliar with the Affordable Housing Trust. Is that the project up on? No.
It's Franklin Ridge, yes.
It's what?
Franklin Ridge.
Franklin Ridge.
Yeah,
It's
the
not
one
that.
next to Eaton Place, across from the police station.
Yeah, behind the high school.
Correct.
But this 250,000 is not.
That does not go to that project. It just goes to the trust, and then the trust can decide how to use it. The trust did not specify that night how they were gonna use the money. They don't have to, just so you know. But they made a pitch at the meeting to give the trust some more money so they could maybe entertain into other projects.
Does that spending come back to us? No. Does not the trust?
So what happens is if you spend money, like say the cupola project was appropriated 70,000, but it came in at 60. Automatically, without any other action, that difference goes back into the budgeted reserve of the Community Preservation Act by the state law.
No, I'm talking about the affordable trustees of the Affordable Trust, or is that community? Who are they? Is there a name?
The Franklin Municipal Affordable Housing Trust. They're a town board.
I've
They're
never heard of them. How's
Okay,
that?
they're a town board. They've been around for about 15 years. They've spearheaded numerous projects in town. In the old days, this started because the planning board, or this is even before, well before I got here, but a lot of the boards would try to buy out, a lot of developers would try to buy out their affordable housing requirements by paying a mitigation payment to the trust. So the planning board might make a decision and say, well, the developer's gotta pay, say, $500,000 in money in mitigation payment to the Affordable Housing Trust. The trust would then take their money and they would go, this is 15, 16 years ago, when you get a foreclosed or a tax title property, maybe you get it at like $275 or $250, it'd be really low money. Those days are long gone, I understand that. But 20 years ago, then the town, Gus Brown and many others, would go rehab the house and then deed restrict that house. So there's a dozen or so affordable houses, ranches throughout the community that were rehabilitated and purchased and deed restricted through the Affordable Housing Trust. The pieces of land and projects they've worked on at a more macro level are Eaton Place and Franklin Ridge, which is under construction now. They have contributed CPA money to those projects in the past. The trust spent $500,000 of its own money on the Franklin Ridge project. So they're actually quite active. You know, I understand it's one of those boards people will obviously gloss over and don't think much of, but over the years they've actually been very active in town. And so the committee came to the CPA during the public hearing and asked for more cash to be able to do more projects. Because now that Franklin Ridge is under construction and you know it's going to open in about a year and a half, they're now trying to plan out their future and say, okay, well now that this is going to move ahead, what's next on the docket? What other ideas do we have, and what other ways can we spend money to try to bring more affordable housing to the community? So that's about it in 2 or 3 minute nutshell.
Are they, the development off Beaver Street, Marks Way, I think it is that the Franklin Housing Trust, or is that something different?
The Housing Authority, I don't know about that property, I just don't know about
There's
it.
like
But the Housing
9 houses.
Authority, and I know,
I was just curious.
The Housing Authority is a whole separate board,
Yeah.
and a separate
State.
committee with separate people that's under the state. They have, some housing authority units throughout the community.
I'm done. Anybody else?
On the open space, Maple Hill principal and interest,
Yes.
what is that?
Yes, so, sorry, Jamie.
No, it's okay.
The open space, when, one of the, getting CPA passed, right, this was a vote that residents passed, was to purchase land that's becomes open space for us.
Okay.
Okay, so we used Community Preservation Act money to purchase the land, and we also can use it to pay back the borrowing for it, the debt and interest, the principal and interest.
So we bought like a piece of Maplegate when it sold?
Not Maplegate.
Maple Hill.
This land is between
It's off Lincoln Street.
Maple Street and Lincoln Street. 70
You know what
acres?
Bridle Path is?
Some of it, yeah.
So-
Hancock?
So we bought a piece of land,
Yes.
and this is just paying for the piece of land we bought, but we're
Yes.
keeping as open space indefinitely.
It's permanent, when it's bought under CPA, it's a permanent conservation restriction.
Yeah, cool, got it.
Same as Schmidt Farm,
Same as Schmidt
which is on Prospect Street.
Got it, okay. Thanks.
So why is it crossed out?
It's not, that's something
The
else.
Maple Hill, that was the implementation of like the parking lots, the kiosks, the engineering, the bridge that needs to be built over some wetland, like a bunch of other projects need to happen. There was a whole 2-year-long master plan public process that went on a few years ago. They had public hearings on all these things, the Conservation Committee, Brika Lai, a whole bunch of other folks. And so, to give access to those parcels of land, there needs to be some infrastructure built to do that, so those monies are for that. I think one of the members that was on the CPA committee, who's also an engineer, just questioned some of it, and they're working on an off-site meeting to kind of figure out answering some of those questions, and the CPA committee set up another meeting on June 15th to come back and revisit that recommendation again.
Okay, so this is not final, in a sense.
Well, for right now, it's
Yes,
final,
okay.
because that's what we have, but until the CPA committee makes a recommendation, this is what's in front of you.
Can some of the repairs at the Kennedy School, not a fair question, the track and the tennis court, could that come out of some of the school enterprise funds?
No.
I don't believe so.
They're revolving funds, just,
Yeah.
just for public.
We would want them
Is
to come out of here too,
specific
right?
to what they were collected
We would
for.
want them to come out of here too. This is a separate tax, and that would come out of the operating budget. This comes out of a totally separate tax line item.
Surcharge.
It's a self-fund.
Surcharge.
Sure.
It's a tax.
A payment we
It's a
make.
tax.
Well, I'm thinking, it's supposed to be for the Community Preservation Act, we're doing some school repairs.
So
But
under
that's-
CPA, so under CPA about 10 years ago, the only legislative change to community preservation that's occurred in its history was that recreational facilities, playgrounds, ball fields could be used under CPA as long as they have public access all day and all night, right? So even though the school hours, the kids will use them, the schools have those playgrounds and fields open for the public to use. In fact, I think the track is used quite a bit by the public, and the tennis courts are, so it does all pass legal muster, so we can use these out of community preservation.
So unrelated to this specific thing, but more just a generalized question. The surcharge, whatever it's called, that funds this, is it possible, like, is that a specific law that allows you to do that just for community preservation? Or could we, in theory, as a community, put a different surcharge on that said surcharge for fire trucks? I don't know, whatever. Chromebook, technology revolving surcharge, instead
that'd be
of
popular.
like going at the 2.5, like instead of like trying to change your fundamental like property tax basis, but instead do it that way. Like, could you have a specific surcharge for a line item like that functions like this, or is that not?
So two quick things, great question. So you can't do a surcharge, it's okay. The surcharge, community preservation is a whole separate state law that was passed in 2000, and I'll just end there, right? So all of this is, and this was a ballot question in 2020 in Franklin. It passed 60 to 40%, and we've been implementing it since. So most of this is fully baked in state law, and there's all sorts of different, conditions under it, like, the council can, deny these projects, but they can't increase the funding. So there's all sorts of other little legal snippets. But what you're talking about is essentially an override or a debt exclusion.
Correct.
For capital, and you can do that. Town just north of here passed a $22 million debt exclusion for all public infrastructure. So it was all capital, generally one-time funds. So you could go out and do something like that. The mechanism and how you would do it would be basically through an override or a debt exclusion.
Okay, but
Depending on
not
what
one
you're asking.
aimed at Prop 2.5 or whatever?
It would all be Prop 2.5 oriented.
It would or would not?
It would. There's no other mechanism. CPA, the surcharge in CPA is statutory. So
Gotcha.
we could do a home rule piece of legislation. I mean, there's a couple of other maybe avenues to get closer to what you're thinking. But ultimately, at the end of the day, you're looking at a Prop 2.5, for that kind of work.
Sure.
For any of those capital needs, you could absolutely do that. You could also do a borrowing and do it as an override as well, right? A lot of communities do that. They might just do a capital investment, but it's essentially going through an override process. But you're just using it for borrowing or for capital purposes, not for operational.
Yeah, despite being potentially annoying to some, that the 40%, fine, but like it was 60-40 voted, which shows like it's maybe a little bit easier to get behind a single topic vote than like a generalized override that now has like everybody slamming all their different ideas into it and nobody knows what it's for anymore. Like a one purpose item seems cleaner if we, sure, but like if we have a,
Well, Bellingham just did a schools only, right?
Yes.
Last night, that passed by 95
Aren't you on the
votes.
joint committee?
sure, if they meet. ever.
I was there the first time for you. It'll be great.
Yeah,
I
we'll
think
meet
you'll enjoy
again
it.
Next year?
No. I have a question about
Thank
this,
you for responding to the doodle poll.
about the,
Just,
I did.
you guys did.
I did.
I thanked you.
I needed a reminder, but I did it.
You set it up.
So the 2.9 that's gonna be used, we moved 2 million over, right? In this, the thing that we just
That's your annual budget.
voted on. And But they're gonna use 2.9, and you said that that's because they have more money in there than the 2 million that they needed, right? So how much is in there now?
Evan, you got the sheet up in front of you, I know you, I can
For
see it.
that specific budget reserve bucket where that project is?
Yes.
So if all those projects were approved, they'd still have 1.9 million in there.
Okay. So my next question is, does anybody know the MGL that governs this?
You could Google it pretty quick. Just Google MGL, Community Preservation Act.
Okay. I just didn't know if this was like on the top of, you had mentioned.
Yeah.
It's governed by statute, so I didn't know if you just knew off the top of your head. I can Google it too. I just didn't know if you knew. Is there anything else, I assume somebody's looked into this, but is there anything else that we're doing that we pay for in our general fund?
Sure.
That we could shove into this?
We do look at
That's
that.
a technical term. No.
Utilize
No.
the lawyer.
The answer is no.
I said what I said.
And the answer is no. And chapter 44B.
Thank you,
For your
okay.
notes. And there's a website, if you want to research more, communitypreservation.org, which has a whole litany of resources, as well as an entire list of projects statewide for 25 years. So you could go through and have a field day. You cannot shove anything else from the operating budget in here, because you cannot use CPA funds for ongoing maintenance. You can only use them for these projects that are outlined in state law. So you can't like buy a piece of land and then put DPW expenses in there on an annual basis to help maintain that land or to maintain school ball fields. So even if Collin gets all this money for playgrounds and they need repairs someday or they need maintenance, you can't use any money for that. So you really can't use CPA money for any maintenance or ongoing operating expenses. So in essence, you're not shoving anything because you can't do any, you can't take school teacher money, you can't take salaries, you can't take police. So there's really nothing operationally that we can move over there.
But you could do capital projects?
Within those three categories.
Correct, right.
And we've
The cupola, is a good one.
I mean,
if Davis Thayer needs a new
The red-
playground, we can do it from here, right?
the Red Brick Schoolhouse.
Red
So
Brick
we've bought two
Schoolhouse.
pieces of open space. We've restored the library numerous times. We've restored the Red Brick Schoolhouse exterior. We've restored the Historical Museum. We've spent 2 appropriations on affordable housing, both on the St. John's project behind the church for that affordable housing complex, and also $320,000 was given to the Franklin Ridge project. So, I mean, I don't want to do a half-hour thing for you on like all the uses of CPA money that we've done so far, but we've used CPA for the Nason Street tot lot. We've tried to use it when we can to try to offset capital expenses.
Okay.
The big win here is that all of our playgrounds, including all of the schools, we've now spent about almost if this is all approved, probably about $750,000 that you're not seeing on the school capital list, because we've creatively tried to make sure that we can use money through this, and kudos to the schools for, you know, I mean, not every school district leaves their playgrounds open for the public or their track. Sometimes they close the gates, so the fact that the schools allow everybody to use their property offline and on weekends is actually enabling us to do this. So it's been a joint effort between both of us, and you know, we're going to continue to do this where we can. But unfortunately, most other stuff on capital wouldn't fit these categories.
Question on that, because I know we have a reserve fund for the turf replacement. Would the turf not qualify? Because that's kind of a capital and a one-time.
It may. I've got to get a legal opinion on that, on the turf, because I know there's been some cases around the turf issues, but it's plausible that you can borrow against the turf. It's plausible, but I just got to get a review from Mark on it.
How much does the fund get regenerated each year? What's the tax collection?
You're looking at $2 million.
All right, so
you're
every
looking
year
at
we
about
get
$2
$2
million
million, so-
a year in revenues and going up a small fraction every year.
And does it have to be spent within the year?
Nope.
Or can you just let it accumulate
You can
and then
stockpile
spend?
the money for a long time. A lot of communities like historic preservation or affordable housing, they'll put money aside for 5-10 years. They won't spend it, and then they can really do something big and important that the communities wants to do. And that's how actually we've gotten to the fact that even with this large appropriation proposal. That's why I haven't, there's still about 1.9 million left in the budget reserve, even after all these expenditures.
Now, the town is involved in the rail line up path, right?
Rail trail?
Rail trail. Can some of this money be used for that?
It could. We're gonna try to use state money first, though.
I would understand that, but this could be something that,
Federal first, state second.
I might have maxed out, I might have dragged all the chips I could out of the federal, but you're right, we will try it on federal as well, 100%. Yep. And we do have $1 million coming, by the way, from an easement that we're granting to the state to do signage on that parcel, so I probably will have a ceremony, probably later summer, early fall, but we're getting $1 million from the state, which will be put into that track line construction as well.
for signage?
No, for construction.
Oh, I thought you said.
No, they want the easement so they can say, this, the trailhead is a state parcel.
Oh, okay,
So it's good for marketing because they own the rest of the SNET trail.
okay.
So they're just giving us a lot of money because they're committed to this project as much as they
Yeah,
are.
Okay, have we beat that one to death? We said?
All
You're
right,
on.
George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes, John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer,
Yes.
Tom.
Yes.
Okay, so next up is motion to recommend resolution 26-30, which moves $709,390 from the snow and ice stabilization fund to the general fund for FY '26.
So moved.
Discussion. Does
Yep.
this pay the bill for the last?
This pays the bill. This pays the deficit that is currently in the snow and ice budget.
Is there anything left in snow and ice?
95,
Dollars.
Cents.
no. I believe it's 95,
It's a minor amount.
it's minor.
I have two questions.
Yeah.
Yep.
84,000.
One, usually, doesn't the state have a supplemental budget to reimburse for some of these expenses?
They usually do. They did appropriate $80 million in some legislation recently, but until I get a letter from the state saying, here's your apportionment, I'm not counting on it. If it does come in, we'll just appropriate it into the stabilization account.
Okay, and question number two, wasn't one of the storms a disaster, declared a disaster, and there's federal funds from FEMA available?
Yeah,
think
it's gonna take a while.
I know that.
I don't think we'll get it.
Yeah, really?
Have you seen FEMA checks anywhere else announced around the rest of the country in the last year and a half? There's no FEMA that almost exists.
I got
I'm not even being cute, I'm being dead serious. The state governments, including the state of Massachusetts, did a $300 million appropriation this year into a disaster recovery fund because states don't have confidence that FEMA is gonna show up, pay the bill, or even respond to a disaster. So I'm not joking, I don't think that money's ever gonna show up. Obviously, if something changes politically in the next several months, maybe it does, but we're not counting on any of that coming in. If it comes in someday, great, but we're not counting on it.
Have we applied for it?
Yes,
Oh, yes.
Yeah,
Yeah.
that's what I was just gonna say.
We've applied for our portion, and the state has applied for their portion, and we haven't heard anything back.
I don't even think they have a FEMA administrator at the moment. So. Okay, any more? Yes? No? We're gonna
All
vote?
right, George,
Yes.
Natalie,
Yes.
Chris,
Yes.
Lauren, yes, John,
Yes.
Ryan,
Yes.
Shannon,
Yes.
Jennifer,
Yes.
Tom.
Yes.
That ends the show.
One more.
One more.
Okay,
Close,
all right,
George, close.
last one. Motion to recommend resolution 2631, which moves 90,000 from the stormwater retained earnings, into the appropriation, I think, for the vehicle, basically for the water enterprise. Am I reading that right?
No, this is for the asset management.
Yeah.
Oh, so
I
asset
apologize.
management, which will go towards that. Okay.
Took the vehicle out.
No.
No? Okay. It just says, I'm sorry, I'm confused by the fact that it says six-wheel dump truck, sander plow.
I
I
apologize.
will admit I was too, so.
So, that is a mistake on my part, and
Okay.
that's called proofreading, and I.
No, that's fine, and I'm like, it's on the paper, I'm reading
So
it.
the one
It's
that,
just-
the one that the hard copy that some of you have
Yeah.
is,
Oh, okay, got it.
my fault.
No, that's totally fine. So just moving 90,000 into the asset management plan.
So moved.
You have any questions for Kate?
Question?
She's been here the whole time.
For the last
And I
item?
thank
I
her.
think she wants to get up to
She's
the mic and talk about it. So. Just came like out of nowhere.
like vehicles, we're not vehicles.
Brutus left.
I know.
Just
Got
keep
tired.
confidence in Keith. And Deb.
Do we need a very Reader's Digest version?
Sure,
or-
there is an attachment. This is a asset management grant, and there's a breakout here that says this is how much the
I thought
grant
I read
is,
it.
this is how much this stormwater enterprise fund is paying, and this is how much the operating budget is paying. So we have to kick in a portion of this as well. But
Okay.
because it's the enterprise fund, I need a resolution to move the money.
We have,
That was a pretty good reader.
so we're just a vote now?
Yes.
I've lost track.
Yes, we're just a
Okay.
vote.
All right, George.
Yes.
Natalie.
Yes.
Chris.
Yes.
Lauren. Yes. John.
Yes.
Ryan.
Yes.
Shannon.
Yes.
Jennifer.
Yes.
Tom.
Yes.
Stabilization fund balances are as shown.
I have a question on that. So if for some reason we can use 1.4 million, if we can fund any of the athletic fields thing that this 1.4 million is currently reserved for, if we can fund that out of the CPA, for some reason it works out great. How does this go, how can we go about, I know because once it's in there, it has to be used for a specific purpose. Is there any way of reallocating it, or is it kind of like, we just maybe don't,
Nope.
we have to use it?
You have to use it that way, and, yeah, it is what it is. So it's your down payment on whatever whenever, or, you know, I think this is also to Ryan's point earlier. We're not doing, with all the other stuff we've got backed up, this ain't happening for a long time, right? So, I mean, I think this is another casualty of the financial situation, but that's essentially your down payment on restoring those fields.
But
So we can't reroute the money anywhere else, it's stuck there, and that's what it is. If we can we may be able to use the difference from community preservation, but we can't reallocate that anymore.
So if we could use CPA money to repair that, you want to know if we can allocate this special purpose fund stabilization to something else, and we can't, because it's special purpose for athletic field repairs.
Got it, okay, but it would be good to know, because if we were in greater times and we were able to fund these accounts, if we knew the answer that we could potentially use CPA funds, we would potentially not add any more into this piggy bank.
Correct.
Yes,
Okay.
thank you.
Correct.
I just, oh, go ahead. I see you getting ready with your finger.
I'm just curious if we should, like, to that end, prioritize these in some capacity, maybe in a future meeting, not tonight, but like, at the moment, they're in an order. I don't know what order.
So they're not in any particular order on this chart.
Okay. Yeah, it's like, maybe it's worth saying, hey,
So there is a financial policy that was brought to all of you. That's where you would put that in there. If you would like to say, this is a priority and this is how much we recommend putting in if we had X amount of money to do that.
And these balances were prior to our transfer approvals tonight.
That is correct. This is as of April 30th,
Yeah.
because I have to wait for interest
Right.
to get it.
Yeah, I just wanted to make sure. Thank you.
There's no motion, that's just.
The other one is just information, just to let you know where we stand with revenues as of April 30th as well. This is something I provide to the Finance Committee.
Is there anybody you're worried about?
In local receipts?
Yeah,
Yes.
or in anything?
that's a broad question.
I mean, you know, meals tax, I'm concerned. You know, we are almost flat to last year, but I'd like it to be more, so I'm hoping
Restaurant week, yeah, you got,
You know, let's go.
now if we had restaurants that you could afford, but that's another story.
Hey,
I-
wait a
I
minute,
do
wait a
my
minute, wait a
part.
minute, wait a minute. We don't discriminate here. McDonald's works. I'm serious. We
Yeah.
get meals tax from Taco Bell. I mean, yep, look at Shannon.
Thank you, Shannon.
Shannon.
Doing my part.
He just gave you 3 cents. It all adds up. So, doesn't matter where, everywhere in Franklin.
This report is 3/4 of the way through the year, correct?
Yes.
So like anything above 75% is theoretically tracking properly?
Yeah, that's correct, yes, you're correct, yes,
Okay.
yep.
What's
So
miscellaneous?
It's very good.
Exactly what it is.
Very good. We should do more of that.
1,836% up?
Right, because we do not,
Know what it is. Right? It's fundamentally
Not that we
budgeted
don't
because we don't know what it
Why
is.
don't you
But
tell,
I can't budget.
or do you want to tell them
Yep.
what's in the,
sure,
somebody,
yep,
about general, I mean, do we?
right, we do know. Linda, can you help with
Yes,
this
I
question?
don't know if
Because
I
you
have a
know
list.
better.
Yeah, I could come up with a list off the top of my head, I could.
But,
Correct.
yeah,
I
top
think
of
that
the
would
head
be
is
enough,
fine.
because it would just
Yeah.
be a generic, it's better than
So there are things
miscellaneous.
that come in,
Right, like our sales for like old vehicles, if we sell off, like surplus property,
municipal bids.
Right.
The procurement officer does. those
court
funds.
fines, trying to think of what else.
So is it just things that are just straight up random?
Yes.
That you have
Unclassified
no
revenue?
idea, they
Right.
could come, they could not come?
It could not come, it might
It's not-
come, right.
Yeah, okay.
We may have gotten a refund from a prior year bill, and we can't put it back into the budget, so I have to put
Right.
it in miscellaneous.
Okay.
Right.
Well, we're killing it in that.
I-
I know.
We gotta do more of that.
Okay.
More
We
miscellaneous.
are, my procurement officer is out there taking pictures and putting everything on Munibid.
Facebook
Yeah.
Marketplace, maybe.
Yeah.
I could come up with a better list and send it to you
Nope.
guys
That
if
was
you want.
100%
Oh, okay.
accurate, or
Yeah.
adequate.
What about fees other? That's lagging. What typically drives that one?
It depends,
Okay.
fees other, so it depends on the time of year. Maybe all the dog license haven't been posted and received into the collector's office, so there's some of that, it depends.
Gotcha.
We have highs and low, just as you know. when-
Where was this one, April 30th last?
So it says, it was at 425, so we're trending up this year at this time.
Oh, perfect. Sorry, it's right there. Could have looked
It's
at that.
okay, Ryan.
My fault.
I had that one right there for you.
So those are fees that we typically do get that we could sort of account for, as opposed to random
Yes, yes.
things that just pop in for no reason.
Yeah. And again, there's going to be a second reading on some fees that the town council will be approving to increase,
Okay.
like passport photos, you know, it's going up. You know, if it gets approved on June, it takes 2 readings. So the department heads constantly look at that to see if they can increase.
Annie, done? Done? I think we're done.
No, I have a question.
Oh, okay.
Are we, I mean, the audit report is for fiscal year '25, which is almost over. I mean, it's over, but almost a year beyond. Why don't we have an audit report from a partner?
So
Come visit.
the audit gets presented from a partner to the town council.
And was that going to occur?
July
I've
22nd.
I've answered that for you several times. You've asked me that a few times
Yeah.
via email, and I said July 22nd. Plus, the audit is out on the website. It is public.
Okay,
Oh, you would
so
like
July
me to say that?
22nd, are we also going to have the 26 audit done, so we can have both years done at the same time?
No.
To have an audit done, presented a year later, it's old news. But I think it has to be done.
Well, first of all,
It
FY
takes that
'26
long.
isn't done yet.
I'm being
I
sarcastic.
know you're being sarcastic.
I'm being
but-
sarcastic.
but I just want to make sure this
Yeah.
doesn't get on
Right.
Facebook.
Right.
We
Well, I
have
mean-
misinformation, so, you know, usually we do them in May, every single year with our OPEB actuaries at the same meeting, and this year the decision was to move it to July, and it is what it is, so I'm not the boss on all these decisions, so other people made that call, and you know, it is what it is. So we'll do it in July. That's all I got for you, Tom.
From my perspective, it's an important document. We talk about transparency, talk about fiscal health. It's nice to have someone from the outside come in and tell a good story.
So this, just to be clear, and I mean this sincerely, and I think you followed this, but I think for other people that are new, I mean, it's not required in Massachusetts to do an audit, right? But we have for 25 years, and I'll give Jeff a lot of credit on that. You know, it started a culture. When I got here, there was management letters with a few things. Every year you improve, and you know, we've been fortunate enough the last 4 or 5 years now not to have a single recommendation from our auditors. You know, and I think to your point, I agree. I wish we could get the presentations out there earlier. I think it's really good news. I think it shows health of the systems of checks and balances. You know, the auditor will always say, you know, they walk in here, no one runs away from them. Every time they ask for something, we get it. It shows good internal controls. You know, it's good news.
Exactly.
But
And
I
that's
don't make these decisions. I don't make all the. I know some people think I make these decisions,
Yeah.
or all, but I actually don't. So other people chose to do it in July. So we're doing it in July. But the audit is out there. It is online, and if I don't know if we sent it to the whole finance committee, but maybe we could.
Okay, sure.
Just so that the whole committee has it, because you came in and got it from us, but.
Right.
Just a couple of notes that I want to make. A, I want to congratulate this committee. This is, I've gone through 13 of these, and this is by far the deepest that any group has gone into this budget, and that's good. People out there who say there's no transparency, they're just not paying attention. This stuff is on, there's videos of it, there's podcasts discussing it, there's enough thing, but the first thing, when the council votes, I'll read on Facebook, Pod and I do it too, was, well, they didn't tell us about that. No, we told you, you just didn't listen. Sorry, that's a pet peeve of mine. And I'll stop, it's late enough. Secondly, these two people beside me, this is their last meeting, and I want to thank them a lot. I mean, you found out, the new people, the scheduling is crazy, and they run longer than they should. That's probably some of our fault, but it's good fault. It's good trouble. That was the in the South. It was good trouble. So, thank you all, and I'll entertain a non-debatable motion to adjourn.
See y'all in September?
Yeah.
Yes.
Couple months off?
There's a song about that, isn't there?
Yeah.
Motion to adjourn.
So moved.
Roll call?
We had, roll call.
Sorry.
All right,
Sorry.
George?
Yes.
Natalie?
Yes.
Chris?
Yes.
Lauren, yes. John?
Yes.
Ryan?
Yes.
Shannon?
Yes.
Jennifer?
Yes.
Tom?